Distinguished ladies and gentlemen, any moment from now, we'll have the representative of His Excellency, the President and Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria join us. And once he makes his way into this auditorium, we rise, and that will signal the beginning of this event. But before then, permit me to once again welcome you and appreciate you all for making it to this historic event, seeking to promote health and the progress of the country. It's customary for me to start events like this by requesting everyone in the room to please put their hands together for themselves. That's my own way of not missing out on anyone who is due to have been recognized or appreciated. So right now, I've been able to appreciate every one of you. Thank you and welcome. On that note, please permit me at the right time, I will establish protocol, but please permit me to recognize some dignitaries already seated in our midst, and of course, setting aside all their other busy activities and being here. Starting with the representative of His Excellency, the Governor of Kano State, Governor Abba Kabir Yusuf, ably represented by the Honorable Commissioner of Health, Dr. Abubakar Labaran Yusuf. I hope with time the energy level gets higher and the sound of the round of applause gets louder. We're actually in the State House Banquet Hall, and it's quite large, and a round of applause needs to be loud enough to be captured. Please put your hands together once again for the representative of His Excellency. We're getting there. I also like to appreciate the support, the patience, the resilience, the sagacity of the Honorable Minister of State for Health and Social Welfare in the Federal Republic of Nigeria, our very own Dr. Isiaq Adekunle Salako. I have here with me, representing the Mayor of Kano, Alhaji Umar Ado Bayero. Let's put our hands together for him, please. I'm sure the signature turban would give him away. We already know he's there. You're welcome, sir. Please join me to welcome other dignitaries here present. We have quite a number of them, and at some point, we will be recognizing them, especially our panelists, who will be duly appreciated and acknowledged when the time comes, but not without recognizing the presence of the Director General of the National Agency for Food and Drug Administration and Control, Professor Mojisola Adeyeye. My Lord is here, the Executive Secretary, Nigeria Christian Pilgrims Commission, and the Aso Villa Chaplain, Bishop Professor Stephen Adegbite. The Director General of the National Health Insurance Authority is here with us in the spirit, but physically ably represented by the Director of Planning, Research and Statistics, Dr. Kofi Abubakar. Please welcome with me from the Green Chamber, the Deputy Chairman, House Committee on Health Services, who is here in his capacity and also representing the chairman of the House Committee on Health Community Services, Right Honorable Amos Mogaji, Representative Basi Akiba. Okay. We also have here another special guest, the Managing Director and Chief Executive Officer of the Nigerian Export Processing Zones Authority, NEPZA for short, Dr. Olufemi Ogunyemi. As I mentioned earlier on, as soon as I have other names, I will duly recognize them, but please join me to welcome from the food baskets of the nation. I hope he's here with this basket. Honorable Commissioner of Health and Human Services of Benue State, Dr. Paul A.J. Oguche. And of course, a sister commissioner from the southwestern states, the Gateway States. Distinguished ladies and gentlemen, my very own sister, Dr. Tomi Koka, Honorable Commissioner of Health in Ogun State. Oh, you're welcome, ma'am. I have here with me a legislator all the way from Edo State. Distinguished ladies and gentlemen, the Chief Whip of the Edo State House of Assembly, Honorable Hussein Mustafa Lekki. It's always a pleasure to recognize the presence, acknowledging the fact that this is the APC Medical Council, a convening, a coalition of health professionals who believe in the Progressives Party of Nigeria, the All Progressives Congress, comprising various health professionals, doctors, nurses, laboratory scientists, pharmacists, physiotherapists, and so many others, and apologies if I missed out your profession. We have here with us, who would be joining and be recognized at the due time, a past president of the Nigerian Medical Association, Dr. Idris Omede. And at this point, I smashed my glasses over a decade ago, but I believe now is the time for us to please rise as we welcome the representative of His Excellency, the President of the Federal Republic of Nigeria, here in his capacity and of course representing His Excellency, the Secretary to the Government of the Federation, a distinguished senator, a former governor of Benue State, now serving as the Secretary to the Government of the Federation, His Excellency Senator George Akume. And shall we please remain standing as we take the first stanza of the national anthem, which will be followed by the prayers while we remain standing.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland.
Thank you very much. To lead us in the opening prayer while we remain standing, I've been directed that the Christian leader in our midst will do this, and to close we'll have the Muslim counterpart. Please welcome to the microphone, my Lord, the chaplain of the Aso Villa, the presidential villa, the chaplain of the president, and executive secretary of the Nigeria Christian Pilgrims Commission, Bishop Professor Stephen Dignitary, to please lead us in the opening prayer.
Let us all pray. Our God and our Father, we thank you for this day. We bless your holy name for your faithfulness. You are the King of kings, the Lord of lords, I am that I am. You have never changed and you will never change. We thank you, Lord, for the medical council of the APC. And we thank you for our guidance today. We thank you for the Secretary of the Government of the Federation, who is representing our father, the leader, Mr. President. Lord, as we go into this program today, we have for the leading of the Holy Spirit. We pray, O Lord, that you will take control. Everything we shall do here today will dance to your praise and your glory. And by the time we conclude, we shall look back and know that indeed you are our God. We thank you because you do far more exceedingly, even than what we can imagine. And for the head of our great nation, you will heal us completely. Father, you lay your hands upon us, and your name is Jehovah Rapha, the Lord our healer. Continue to protect and guide us, O Lord. Be with everyone dwelling in Nigeria. Thank you, Holy Spirit. Blessed be your name, our great Redeemer. In Jesus' most wonderful name, we are praying. As you taught us together, we would say, Our Father, who art in heaven, hallowed be your name. Your kingdom come. Your will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thy is the kingdom, the power, and the glory, forever and ever. Amen. Thank you.
Thank you very much. Can we please appreciate the Lord Bishop once again? Today is one of those special days in the spiritual life of every Nigerian. A day where, as faith would have it, we're observing the Christian fasting of Lent and the Muslim fasting of Ramadan at the same time. Thank you, and may the Lord answer our prayers. Another round of applause for the Bishop, please. Your Excellency, President Bola Ahmed Tinubu, GCFR, President and Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, ably represented by His Excellency, the Secretary to the Government of the Federation, Senator George Akume. The Right Honorable Speaker of the House of Representatives of the Federal Republic of Nigeria, Right Honorable Abbas Tajuddin, PhD, GCON, ably represented by the Chairman, Committee on Health Institution and Health Services. Other distinguished members of the National Assembly here present. Your Excellencies, the Executive Governors here present and ably represented. Our Royal Fathers here present. The Honorable Minister of State for Health and Social Welfare, Dr. Isaac Adekunle Salako. Other members of the Federal Executive Council here present. Chief Executives of parastatals here present. Honorable Commissioners of Health from states across the country. The Director General of the APC Medical Council, Dr. Samuel Adetoye. The Chairperson Convention Planning Committee, Dr. Olukemi Ogunyemi. Our invited guests and panelists, distinguished members of the APC Medical Council, my Lord, spiritual and temporal, gentlemen of the press, ladies and gentlemen. Our leaders of thoughts and action, custodians of policy, practice, and people-centered governance. Highly revered professionals saddled with the responsibility of taking care of our nation, Nigeria. Good morning and welcome to History in the Making. Today, We're not merely gathered for another conference. We're here for a national conversation, one that speaks to life, dignity, productivity, and progress of our great nation, Nigeria. For us, it's about health and progress. This is the National Health Convention Roundtable 1.0, convened by the APC Medical Council. Distinguished ladies and gentlemen, my name is Hamid Adediran. I have the distinct honor and privilege of combining the dual prestigious professions of being a medical doctor and a broadcaster. And for that, those who know me call me the Medicaster. I'm particularly honored to be the anchor for today, and I promise you it's a packed event that will leave pleasant memories in our minds. To set the tone and tell us more about why we're gathered here, please welcome the chairman of the Convention Planning Committee. You must have seen her move the length, breadth, and if possible, the heights of this auditorium. Distinguished ladies and gentlemen, Dr. Olukemi Ogunyemi, Chairman, Convention Planning Committee, please.
Oh, where's my protocol? Yeah, they didn't give me this. Apologies, this is technology at its best. I had my written paper, but they said this is technology is going to show here, but half of it is not showing. So I am going to just say good morning to everybody, and the President of the Republic of Nigeria, President Bola Ahmed Tinubu, GCFR, ably represented. Sorry, I'm going through. By His Excellency, the Secretary, thank you very much. This is not showing. The protocol. Protocol. Okay, we'll start this again. Sorry about that. This is still the wrong one. His Excellency the President, Bola Ahmed Tinubu, GCFR, President and Commander-in-Chief of the Armed Forces, Federal Republic of Nigeria, ably represented by His Excellency, the Secretary SGF of the Federal Republic of Nigeria. Everything's coming off. I'm so sorry. Apologies. Okay, please come. I should have had my paper, jejely, and I'd have just read it out. So, yeah, I'm looking for. This is not showing this one. Yeah, no, I don't want to take the whole protocol. Thank you. Can you come? Where's the MC? Where's the MC? Can you tell him to come? This is wrong. Where's your paper? Where's your paper? I have to remember the name of this. Okay, we're going to start all over again. Scratch all that. That was practice session for all of you to see. Yeah, thank you. Clap for me. Thank you. Yeah, they wanted me to bungle the whole thing. I'm so sorry. So we're now started again. So video, scrap all that. His Excellency the President Bola Ahmed Tinubu GCFR, President and Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, ably represented by His Excellency Senator George Akume, CON, who is the Secretary to the Federation. Thank you all so much for coming. Now we go to My name is Dr. Kemi Oguyemi. I'm the Special Advisor to the Lagos State Governor on Health. I'm also the Chairperson of the APC Medical Council Convention, the very, very first one. The APC Medical Council is honored to welcome you to this inaugural, here we go again, to this inaugural health convention. Your presence here today is a testament to the importance of healthcare in our nation's development. Good health, as we all know, is a state we all strive to achieve, and its importance cannot be overemphasized. The All Progressive Congress, APC, under the administration of President Bola Tinubu, GCFR, has prioritized healthcare improvement in Nigeria, focusing on maternal and child health, primary health care, and staff recruitment. President Bola Ahmed Tinubu, GCFR's administration has launched initiatives to reduce maternal and child mortality, including direct funding to primary healthcare facilities, improved availability of essential commodities, and recruitment of community health workers. The Maternal Mortality Reduction Innovation Initiative was launched in 2024 in local government areas in 33 states, aiming to improve maternal, newborn, and child health services. 2.9 billion naira worth of essential commodities were distributed to 1,936 primary health care facilities across 80 local government areas. Health sector renewal investment initiative, strengthening primary health care facilities, deploying skilled birth attendants, expanding health insurance coverage, and scaling up free emergency obstetric care. Distinguished guests, ladies and gentlemen, improving our healthcare system is a priority, and so therefore investment in healthcare initiatives is important and should not be limited. We have brought together experts from across our nation to discuss some critical issues shaping Nigeria's healthcare landscape and explore opportunities for improvement. All of you, your leadership and expertise are crucial in driving progress in our healthcare system. Once again, welcome to this inaugural convention. Let us work together to build a healthier Nigeria. God bless you all. God bless the Federal Republic of Nigeria. Thank you for listening. And thank you for the patience. Thank you.
Thank you very much. For those that are not Gen Zs here, you remember that old MTN advert where a man actually left his speech and the daughter read the speech to him on the phone. Who remembers that advert? That's what I just remembered now. Another round of applause for the CPC chair, Dr. Kemi Oguyemi. Yes, because I have as much faith in this company as I have in my own child. Ladies and gentlemen, while the chairman Convention Planning Committee was giving her welcome remarks, I'm not insinuating anything in terms of whether the voice of Dr. Oguyemi called him from wherever he is to join us right away. I'm not saying whether the voice is a familiar voice from childhood, but we have joining us the Chief of Staff to the President of the Federal Republic of Nigeria and the erstwhile Speaker of the Federal House of Representatives, our very own Right Honorable Femi Gbajabiamila, CFR. You're welcome, sir. Distinguished ladies and gentlemen, we also, I have a list of dignitaries that have to recognize in due course, but I will do them in batches as soon as I have them. But please permit me to quickly recognize as well, oh yes, the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency, our very own Dr. Muyi Aino. You're welcome, sir. We're here to discuss universal health coverage, and definitely the primary health care is a formidable tool to do that. Please welcome to the microphone the leader of the APC Medical Council, the Director General of the APC Medical Council, to give his welcome address. Distinguished ladies and gentlemen, please appreciate for this initiative Dr. Samuel Adetoye. You're welcome to give your speech, please.
His Excellency, the President and Commander-in-Chief of Armed Forces of the Federal Republic of Nigeria, Asiwaju Bola Ahmed Tinubu, GCFR, ably represented by the Secretary to the Government of the Federation, His Excellency Senator George Akume, Right Honorable Femi Gbajabiamila, the Chief of Staff to the President, the distinguished Minister of the Federal Republic of Nigeria here present. I will use the Minister for State on Health, my very home brother, Dr. Isiaq Kunle Salako, members of National Assembly here present, leaders of all Progressive Congress, all the head of parastatals and agency. I will use Dr. Muyi Aino as a point of contact. Leaders of all Progressive Congress, esteemed healthcare professionals, distinguished guests, ladies and gentlemen. Good morning. It is with profound honor, deep gratitude, and a strong sense of responsibility that I stand before you today as the Director General of the APC Medical Council to welcome you to this historic National Health Convention and Roundtable 1.0. Let me state clearly and confidently, this is a landmark moment in Nigeria political and healthcare history. To the best of my knowledge, and our knowledge as a whole, no political party in this country has ever conceived, proposed, or institutionalized a structured medical council within its framework, as we are doing today. This program is historic, it is visionary, and it is transformational. This gathering represents more than a convention. It represents innovation in political organization. It represents foresight. It represents leadership. And that is who we are as a party. We lead and others follow. History will record that this initiative began with the All Progressive Congress. The APC Medical Council was established with a clear and strategic objective to create a structured, professional, and policy-driving body of medical and healthcare practitioners within our great party. For too long, medical engagement in political structure has been informal and largely ad hoc. Healthcare support in political activities is essential. It is about safety, preparedness, emergency response, and professional accountability. Our vision is to ensure that the APC has a permanent, organized, trained, and disciplined medical structure that is active in all party engagements, conventions, congresses, rallies, meetings, and national assignments. Your Excellency, Mr. President, permit me to sincerely express our appreciation. Your leadership has demonstrated that this administration is medical friendly and healthcare conscious. Today, within your cabinet, we have 6 ministers who are medical doctors, 1 minister who is a pharmacist. Alongside several other healthcare practitioners occupying strategic positions. This reflects deliberate recognition of our professional competence in governance. Beyond ministerial appointments, this administration has continued to appoint healthcare practitioners into key board, agencies, commissions, and advisory roles. On behalf of APC Medical Council and healthcare professionals across our great party, we say thank you, Mr. President. While we deeply appreciate the confidence already shown in healthcare professionals, we humbly plead for continued and expanded inclusion, particularly within the Ministry of Health and other health-related sectors, so that more qualified medical and healthcare practitioners may serve in strategic roles. Earlier today, members of APC Medical Council voted on a memorandum seeking the formal inclusion of APC Medical Council as an official wing of all progressive Congress. Secondly, the creation of a medical service directorate within the APC secretariat. This proposal has a strategic necessity. Institutionalizing the APC Medical Council will ensure structured medical coverage at party events, improve emergency preparedness, guarantee professional accountability, and eliminate the inefficiencies of ad hoc arrangements. This program signals the revolution of political organization in Nigeria. It demonstrates the professionalism and politics can coexist. When others begin to replicate this model, it will not surprise us because leadership sets the pace. The APC Medical Council remains committed to supporting policies that strengthen the primary healthcare, improve workforce welfare and retention, expand emergency medical system, and promote sustainable healthcare financing. To all healthcare professionals present here today, this is your platform. To the leadership of our great party, thank you for the openness. To Mr. President, thank you for your trust in healthcare practitioners. Let history remember that on this day, our party did something unprecedented. Let history remember that we institutionalized professionalism. Let history remember that we led and others follow. Thank you for your attention. God bless the APC Medical Council. God bless all Progressive Congress. God bless the Federal Republic of Nigeria.
If he had not led the council well, we wouldn't be here. And I think he deserves a louder round of applause. Thank you, the DG. While the speech was on, please permit me to recognize the presence of the Honorable Minister of State for the Federal Capital Territory, yet to get a landed property in the FCT, and I hope this is an opportunity to achieve that. a consultant family physician herself, Dr. Mariam Mahmoud Bunkuri. And someone said if you have to identify with the FCT, you must be able to dance. I was impressed to see her dance steps recently in one video like that. You're welcome, ma. We also have here with us, I had earlier recognized him, but I think he just joined us in person, representing the Right Honorable Speaker of the House of Representatives, Right Honorable Speaker Tajuddin Abbas. He is the Chairman, House Committee on Health Institutions, Honorable Dr. Patrick Umar. You're welcome, sir. At this point, we'd like to take a few goodwill messages. Let me state that the goodwill messages will be taken in batches as directed and coordinated by the Secretariat of the APC Medical Council. To lead this, it's my honor and privilege. He had to actually divert and reroute his convoy just to attend this event. Distinguished ladies and gentlemen, we are pleased and honored to have here with us, as I invite to the microphone, the Chief of Staff of the Federal Republic to the President of the Federal Republic of Nigeria, erstwhile Speaker of the House of Representatives, our very own dear Right Honorable Femi Gbajabiamila, CFR. And please note that I schooled in Ibadan, in case you notice a switch or an improvement in the elocution after I leave the microphone. You're welcome, sir.
Thank you very much. Let me very quickly recognize His Excellency, the President of the Federal Republic of Nigeria, who's ably represented here by none other than the Secretary to the Government of the Federation, George Akume. You're welcome, sir. The Speaker of the House, who is also here represented by the Chairman, Health Institutions, members of the House, senators here gathered, honorable ministers, particularly the Minister of State, Health, Honorable Salako, and the Minister of the Federal Capital Territory, Dr. Miriam. Ladies and gentlemen, I am delighted to join you today at the APC National Health Convention and Roundtable, organized by the APC Medical Council. I want to especially thank the Council for its thoughtful decision to hold this health gathering and for choosing this apt theme, investing in health, building a sustainable healthcare system for Nigerians. Like Dr. Adetoye said earlier when he was giving his remarks, this is a first of its kind initiative here in Nigeria. Healthcare provision is a key aspect of the renewed hope agenda of President Tinubu's administration. I must commend His Excellency, President Bola Ahmed Tinubu, for his transformative efforts in providing qualitative and affordable healthcare to Nigerians, knowing that a healthy nation is a wealthy nation. Nigeria cannot achieve its goal of being a giant in the Community of Nations if its workforce and citizens are unwell and unable to access quality and affordable health care. The government has intensified efforts to bridge the gaps identified in the health sector since assuming office. This is being achieved through life-saving policies and sustainable projects across the primary, secondary, and tertiary healthcare systems, both at the national and subnational levels. A lot has been done, including the launch of the Nigerian Health Sector Renewable Initiative and the Universal Health Coverage Compact, among other laudable initiatives. As the Chief of Staff to the President, I am aware of the significant progress made through the Primary Healthcare Revitalization Program, which has upgraded many primary healthcare centers. We have also made notable achievements in recruiting skilled birth attendants and community-based health workers aimed at reducing maternal and infant mortality. This among other health restructuring programs. I appreciate the extraordinary efforts of the Honorable Minister of Health in championing the health agenda of Mr. President. He has provided leadership and commitment to rewriting the health history of our country. I enjoin the leaders and our great party, well, the leaders of our great party, APC, especially the governors, to support the efforts of Mr. President's agenda by making visible impact in the health sector in your various jurisdictions. You are closest to our citizens in the grassroots, and I also recognize the input of our development partners on this journey and ask you continue supporting the government's efforts in achieving the healthcare agenda of President Bola Ahmed Tinubu. Ladies and gentlemen, let's join hands to build a prosperous and robust healthcare system for our dear country. And I wish you all a fruitful deliberation. God bless the All Progressive Congress, and God bless the Federal Republic of Nigeria. I am going to please ask for your indulgence to allow me sit for just 5 minutes before I take my leave, because I'm all over the place today. I have to be somewhere. I have to be in 2-3 other places at the same time. I know I can sometimes appear to be a magician, but this time around, today's schedule is just absolutely unbelievable. So I will just sit for 5 minutes, soak in some of the things that are meant to be soaked in today, and take my leave. Thank you for having me.
Thank you very much. We're indeed honored to have you in our midst, the Chief of Staff to the President. Another round of applause for the Chief of Staff, please. And in case you felt a breeze while the speech was ongoing, it's the breeze bringing in and ushering in our very own father. For some people, it's so much to refer to them, past this, past that. And it's always impressive when you have them still actively in service to the nation. Distinguished ladies and gentlemen, he served the good people of Nigeria as the #1 chairman of the ruling All Progressives Congress. He served the good people of Kano State as the executive governor of Kano State for a maximum of 8 years, and I'm sure if he had the opportunity, he would have actually been returned again. Distinguished ladies and gentlemen, still very much active in service and officer of the Order of the Federal Republic, Alhaji, His Excellency Alhaji Abdullahi Umar Ganduje. Did you see how briskly he stood? Thank you for joining us, sir. We also have here with us other dignitaries from the presidency. Joining us is the Senior Special Assistant to the President on Women's Health, and I must sincerely apologize because she's been quietly seated for quite a while, quite unassuming, leading conversations that would change maternal health indices in Nigeria. One of those who we love to celebrate as they came back to Nigeria to fix the country, Dr. Adanna Steinaka, the Senior Special Assistant to the President on Women's Health. I also must apologize. I was trying to catch his very tall physique, and I wasn't able to do that, and that's why I didn't call the name. But please welcome the National President of the Association of Medical Laboratory Scientists of Nigeria, Dr. Kasmir Ifeanyi. Oh yes, unmissable. At this point, I'd like to bring to the microphone for a Goodwill message. Actually would have loved to bring in His Excellency Dr. Abdullahi Umar Ganduje immediately, but I'd also love to allow him catch his breath. So on that note, please permit me to invite to the microphone the Senior Special Assistant on Women's Health to Mr. President, Dr. Adanna Steinaka. I would assume that all women here would appreciate her for coming. You're welcome.
Thank you. His Excellency, President Bola Ahmed Tinubu, Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, ably represented by His Excellency, Secretary General of the Federation, Senator George Akume, CON, the Chief of Staff to the President of the Federal Republic of Nigeria, Right Honorable Femi Gbajabiamila, CFR, Speaker of the House of Representatives, ably represented, His Excellency, Abdullahi Umar Ganduje, OFR, former Executive Governor of Kano State, Minister of State for Health, Honorable Dr. Ishaq Kunle Salako, Honorable State Commissioners present, heads of parastatals present, heads of civil society organizations, members of the APC Medical Council, allow me to stand on all existing protocols. It is an honor to address this National Health Convention under the theme, Investing in Health, Building a Sustainable Healthcare System for Nigerians. And no system can be called sustainable if women's health is not structurally prioritized within it. And so therefore, I would like to acknowledge the visionary leadership of His Excellency, President Bola Ahmed Tinubu, GCFR, whose administration has demonstrated a clear commitment to advancing the health and well-being of Nigerian women. The establishment, for the first time in Nigeria's history, of the Office of the Senior Special Assistant to the President on Women's Health marks a historic shift, signaling that women's health is not a peripheral concern, but a national priority. That decision was not symbolic, it was structural. It signaled clearly that women's health is not a side conversation, it is central to national development. Under the leadership of the Coordinating Minister of Health and Social Welfare, Professor Mohamed Ali Pate, national health reforms remains firmly anchored within the Federal Ministry of Health. The Office for Women's Health works in coordination with that leadership under the Renew Her mandate to ensure that women's priorities are elevated, integrated, and measurable within broader systems reform. Through this mandate, we have strengthened engagement with civil society, professional bodies, and frontline health workers, creating for the first time an institutional entry point for structured dialogue on women's health challenges. Let history record, therefore, that at this moment in Nigeria's reform journey, we chose structure over symbolism. We chose systems over slogans. We chose to build a health architecture where no woman is invisible in policy, where no mother dies while giving life, and no girl is excluded from opportunity because care failed her. Women's health is not an afterthought of development. It is the foundation of it. I commend the APC Medical Council for convening this dialogue. Let us continue to invest not only in structures, but in the people those structures are meant to serve. Thank you, and may God bless the Federal Republic of Nigeria.
Thank you very much. Another round of applause for the SSA to the President on Women's Health. May I, at this point, I understand that some of our dignitaries have some pressing issues to attend to, but I'd like to now bring to the microphone the former past chairman of the All Progressives Congress, I understand he would give his goodwill message in just a matter of a few minutes. So please come forward. Ladies and gentlemen, please welcome to the microphone His Excellency Dr. Abdullahi Umar Ganduje, OFR.
Thank you. Sorry for coming late. Your Excellency, the President of the Federal Republic of Nigeria, Asuwaju Bola Ahmed Tinubu, ably represented by my friend, my brother, the Secretary to the Government of the Federation, Senator Akume Ufandeva Umswe. Your Excellency, the Chief of Staff to Mr. President, the representative of the Speaker of the National Assembly, the Honorable Minister of State, Minister of Health, please let me hold the existing protocol because of time. I'm truly delighted and honored to be invited to this important roundtable where highly reputable professional health practitioners and development partners will discuss health-related issues that would eventually add value to the efforts of the present administration in addressing health challenges in our country. I want to thank you most sincerely for this privilege to deliver a goodwill message. For me, this forum organized by our party medical council, including the allied health professionals, is far more than a routine conference. It is a clear affirmation that the APC is not merely a political platform, but a progressive movement anchored on confidence, vision, and the active participation of professionals who are committed to add value to our national development. As we are all aware, healthcare is not just merely a sector. It is indeed another policy area that is central to a national productivity, social stability, and economic resilience. A healthy nation is a secure and prosperous nation. In order to achieve effective healthcare delivery, the leader of our party, President Bola Ahmed Tinubu, has continued to emphasize that effective governance must be informed by professionals and experts who have the ability and capacity to initiate policies and programs that will add value to the development of various factors in the country. I believe that the APC Medical Council represents a bridge between policy formulation and professional knowledge that will ensure that reforms are practical, sustainable, and impactful. As stakeholders, we take pride in seeing doctors, specialists, professionals, researchers, and healthcare administrators stepping beyond clinical spaces to contribute meaningfully to public policy making. Nations make lasting progress when professionals engage constructively in governance, offering solutions grounded in experience and global best practices. I therefore urge you to ensure that our deliberations produce actionable recommendations that will strengthen primary healthcare systems, expand access to quality tertiary services, improve health financing frameworks, and accelerate ongoing reforms across the Federation. I also believe that the leadership of the party will consistently continue to champion the future of healthcare delivery in Nigeria by encouraging such structured engagements where experts meet leadership and policy aligns with national needs. On behalf of APC stakeholders across the country, I affirm our unwavering support to the APC Medical Council. Together through collaboration and strategic commitment, we'll continue to build a healthier, stronger, and more prosperous Nigeria. I commend the organizers for this important initiative and wish you fruitful and impactful deliberations. Thank you, and God bless.
Thank you very much, Your Excellency, for the affirmation of the APC Medical Council. Please, another round of applause to that. That's a very huge one. Very huge one. The father of APC Nigeria has spoken. You're welcome, sir. We'll take other Goodwill messages much later, but please permit me to bring to the microphone, because he has other pressing national issue that can't actually wait for him. We don't want more our hangars, private jet hangars, to be more congested because people like Dr. Muya and all would have to catch flights like this. So very humble and unassuming. He can't actually afford it, I can tell you, but he's quite humble. So please, let's accommodate the presentation from the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency on strengthening primary health care for universal health coverage. Thank you and welcome, sir.
Thank you very much. His Excellency, President Bola Ahmed Tinubu, GCFR, President of Nigeria, represented by His Excellency, the Secretary to the Government of the Federation, Senator George Akume, sir. Your Excellency, Right Honorable Femi Gbajabiamila, just on his way out, the Chief of Staff to Mr. President, CFR. The Right Honorable Speaker of the House of Representatives, represented by Honorable Dr. Patrick Umar, who I will use as a contact to other members of the National Assembly here present. His Excellency and our leader, sir, Abdullahi Umar Ganduje, former chair of our party and former governor of Kano State, but also someone that I can personally vouch is a champion of health. I worked very directly with him in Kano for a number of years. Honored to have you here, sir. Other excellencies, distinguished governors and representatives, honorable commissioners present. Oh, my boss, honorable minister, apologies, sir. Dr. Ishak Adekunle Salako, honorable minister of state for health and social welfare. As a contact for other honorable ministers, I see Minister of State for FCT. Very respected leaders of the APC, members of the Medical Council, members of the Planning Committee, Convention Planning Committee. Ladies and gentlemen, please permit me to use the established protocol just in the interest of time, sirs and ma'as. It's really an honor for me to address this distinguished audience today. I want to start with very respectful regards. I believe my Honorable Minister of State will speak more to that, from the coordinating minister as well, who of course would have loved to be here. Your Excellencies, you will recollect, and this has been mentioned a few times already, that in December 2023, President Bola Ahmed Tinubu launched the Nigeria Health Sector Renewal Investment Initiative, which is being led by the ministers, Honorable Minister of State for Health and the coordinating minister. The Health Sector Renewal Investment Initiative is our national blueprint to save lives, to reduce financial hardship and deliver health for all of us Nigerians. At its core is primary health care, strengthening primary health care. Primary health care is the foundation of President Tinubu's government's drive to achieve universal health coverage for Nigerians. So why does primary health care matter so much? We all know that when primary health care works, our women can safely give birth to healthy babies. Our children are spared from sickness and deaths from vaccine-preventable illnesses, including even some cancers, as we well know, as well as common ailments like malaria, where we have vaccines against them now. Even diseases for more seasoned citizens, like many of us here today, diseases like hypertension and diabetes, among others, can be detected earlier and effectively managed to prevent complications and even premature death if we have a well-functioning primary health care system. Very importantly as well, Your Excellencies, distinguished audience, families avoid catastrophic health spending, and our human capital is protected when it works. When it doesn't work, the converse happens. Secondary and tertiary facilities become overstretched and less effective at actually delivering the specialized care that they are set up to do. Preventable morbidity and mortality increases, and this affects overall trust in government. Primary health care is in fact retail governance, because for many Nigerians, that is usually the first contact with government at all levels. This is true for many of our citizens. Over the last 2.5 years, President Tinubu's renewed focus on primary health care has triggered important reforms that are starting to expand access to basic services for all Nigerians. The North Star of our strategic blueprint, as guided by the President's Sector Renewal Investment Initiative and the Ministry of Health and Social Welfare strategic pillars, is to guarantee all Nigerians, all of us, access to quality basic healthcare services that they trust and they can afford. To achieve this, we are pushing very hard on a number of prongs. There has been mention of the primary healthcare revitalization reform. The President Tinubu has set for us a target of 17,600 functional primary health centers across the country in the course of by 2027. When we came in, less than 2,000 facilities across the country met the basic criteria of the infrastructure, the buildings, the equipment, the workforce, power, water and sanitation services that you need to adequately provide 24-hour services across the country. So the President charged us, equipped us, funded us, and told us to get to work. And in the last 2 years, or slightly under that, we've been able to revamp and fully revamp an additional 2,565, and work is ongoing on 1,456. So thank you. So in the next couple of months, President Tinubu will have added 4,000 plus additional fully functional primary health centers across the nation. It's important, yes. It's important to highlight that some of this is being done directly by the federal government, but a substantial portion of it is also being done by the states, because fortunately, with the leadership of the president, a lot of our governors have also taken hold of this and really running with it. We have installed reliable power, solar, boreholes, as well in hundreds of PHCs. And all of this, by the way, one of the tenets of this administration is also transparency and accountability. And all of this can be tracked real-time online by everybody, wherever you are. If you go to the website of the National Primary Healthcare Development Agency, or you just go to www.phc.nphcda.gov.ng, you can locate any location, any ward in this country, any local government, the state of the primary health centers, which is being revitalized, which is on the list, what services are available, how many health workers are there, and what you can expect to get. There's also a platform to provide feedback so that we can continue to improve, because we don't yet pretend that we have all the answers. The Basic Healthcare Provision Fund is the core of financing for primary health care, as stipulated in the 2014 National Health Act. Between 2023 and 2025, 65.9 billion naira was disbursed through all of the pathways, all of the gateways of the Basic Healthcare Provision Fund. Almost half of that, just under half of that, through National Primary Healthcare Development Gateway to go through states to health facilities directly. And in the last quarter alone, the number of PHCs that are funded directly through this intervention by the federal government has gone from 8,309 to 13,521. What that means is that you have 13,521 facilities today across the country in all your local governments, in all your communities that have the operational resources to keep on the lights, to hire ad hoc staff, to buy the commodities that they need. The amount that they get has also been increased. It used to be 300,000 per quarter. It's now 600,000 per quarter for low volume facilities and 800,000 quarterly for those that are higher volume. To strengthen accountability, of course, when you pour this much resources down the system, we have to make sure there's accountability and value for money. So we have rolled out a financial management platform where we're digitally tracking expenditure. It's now in 7 states, and we're actively expanding it. And before the first half of the year, we should be in all of the states in the country. In addition to the health fellows that many of you are aware of that the president sent to all of the 774 local governments, we also have performance and financial management officers, 1 per local government. Every one of the 774 local governments in Nigeria has one of them, whose job is to keep an eye and participate and watch and report back, but also provide technical assistance when facilities are struggling at that level. Mention has also been made, ladies and gentlemen, on the focus on frontline health workers. President Tinubu is Africa Union champion for community health workers, and that's something that he's taking very seriously and is investing in. He's charged us to retrain 120,000 health workers over 4 years, and I'm happy to say that as of today, we're at over 78,054, and we know that we will surpass the target before 2027. In addition, we know that training is important, but there are many places where we don't even have enough health workers. So again, through interventions deployed by the federal government and our partners, we're able to work with states to incentivize them to hire health workers. And just in 7 states that I immediately had the data to me today, over 3,100 skilled birth attendants have been recently hired. Community-based health workers, and over 19,000 skilled birth attendants. So midwives, nurses, doctors, some community health workers who have been upskilled to be able to take delivery. We're also digitizing the learning for these people so that it's more self-paced, it's more scalable. We now have over 357 modular videos, and are being translated to Hausa, Yoruba, Pidgin English, and Igbo right now, so that it's more accessible to even the most basic of our healthcare workers to continually improve their skills in an efficient and more affordable way. We're fortunate in this area as well to have enjoyed contribution from multiple partners. Her Excellency Senator Oluremi Tinubu, CON's Renewed Hope initiative has also helped us significantly. She, among other things, recently donated 60,000 safety kits to health workers across all of the states. So it's uniforms, it's protective shoes, that when you go to your PHCs now, you see some uniformity in the way they dress, and we are very grateful for this support. The moderator earlier on, actually Dr. Ogunremi, mentioned Maternal and Newborn Mortality Reduction Innovation Initiative, MAMI, which is an initiative targeted at urgently reducing unnecessary deaths among women just because they want to have a baby. We did an analysis and identified 172 local governments that account for the most of this, more than half of the deaths. And so we have rolled out an initiative to identify all the pregnant women and support them through the pregnancy, make sure they attend ANC, make sure they get the diagnostics that they should get, they get the commodities and the treatments that they should get, and link them, working with our sister agencies, of course, to more advanced facilities where there is a risk of complication. More than 500,000 pregnant women are currently being followed. Among them, we've recorded 5 million plus antenatal care contacts, and many of them have been supported to receive ultrasound scans and other diagnostics as necessary. Immunization remains one of the most cost-effective interventions in primary health care. We have many children, unfortunately, that have missed the basic vaccines, and so we continue to have outbreaks and pockets of vaccine-preventable diseases here and there. So what we have done is to map those areas and started to enumerate children. And many of the state representatives here have worked very closely with us to try to take a line list of these children and follow them and make sure every child gets the vaccine that they should get. 21 million children have been enumerated, and about a third of them have now received the vaccines that they are missing. But what is important is that over 500,000 of them were previously zero dose, meaning they didn't have any vaccine before now. 542,000 of these children have now received the first dose of Penta. Polio cases, Nigeria has remained free of wild polio virus, but we have contended with the circulating variant type of the virus. And since the president has been in office, we have reduced the cases by almost 50%, 48% when you compare the numbers in 2023 to the numbers in 2025. The president was also, very deliberate in pushing us to introduce new vaccines that are very important. The human papilloma virus vaccine, we have reached 16.7 million young girls, and they are now protected against the risk of HPV, human papilloma virus, and cervical cancer. I think that is applaudable. The measles rubella vaccine has reached, yes please, for the president, that is. I'm sorry, gentlemen, if that was for me, I'll take it, but for the president, it should be more. Yes. For the measles rubella campaign that we just wrapped up in the rest of the southern states, we started in the northern states with FCT and Oyo late last year. We have reached 101.8 million people out of 106 million that we estimated, which is the largest integrated campaign that has happened globally and is being applauded. We have introduced the malaria vaccine, among other things, cerebrospinal meningitis vaccine. We were able to vaccinate 5.47 million people and curtail outbreaks in 23 local government areas in 7 high-risk states. When we came on board in 2023, there were lots of meningitis and diphtheria outbreaks in many different places. Very importantly as well, this government has reliably delivered on needed vaccines for our pilgrims across religions, both for Christians and Muslims, to ensure that Nigerians can fulfill our religious obligations as we wish. Ultimately, we are making progress towards universal health coverage. And the way you know this is that service utilization has increased significantly. When you look at general attendance at our primary health centers, in Q4 of 2023, we had less than 30 million people for the quarter. Contacts, not in individual people necessarily. Some people go twice or even thrice in a quarter, but 30 million service contacts in the facilities. Now, it's 46, 47 million per quarter, and that is significant. And that trend, you see quarter-on-quarter growth because the trust of Nigerians in the primary healthcare system is starting to come back. We're not where we need to be, but the way you know that that trust is starting to be rebuilt is that people are actually coming forward to utilize the services. Whether you look at antenatal care, whether you look at immunization, you look at all of the basic services, the numbers are rising significantly. These increases reflect strong retention and growing trust, like I said. Also, as insurance enrollment expands under our sister agency, the National Health Insurance Authority, the reducing out-of-pocket spending and pressure on secondary and tertiary facilities continues to advance us towards universal health coverage. We're not done. We will continue to double down on PhD revitalization. On MAMI, the target is to reach 2.6 million women this year. On immunization, we still have many unreached children, and we're pushing very hard to reach them. But I think I will just end by saying that APC, as the ruling party, must lead in accelerating. APC states, APC stakeholders must accelerate and showcase President Tinubu's health achievements, among other things. Primary health care is the foundation of universal health coverage, and we have made measurable progress. I have just touched on a few of them. And even though we're not done, the trajectory of President Tinubu is very clear, and we can all be very proud of that. Thank you. God bless the APC. God bless Nigeria.
Thank you very much. It's indeed a loaded scorecard, and as the ED was making his speech, I saw the representative of His Excellency, the President of the Federal Republic of Nigeria, the SGF, either taking notes or scoring him. It reminds me of my days in medical school during OSCE, when you are performing something and your examiner pen is just hanging, then you are simply not doing it right. But when you see your examiner busy, ticking or writing notes as you're speaking, then you're probably right. If you can relate, let me just see you wave your hand. Yes, yes, yes. Thank you very much once again. Another round of applause for the ED and PhD, Dr. Muyi Aino, and we wish you a safe flight. At this point, Your Excellencies, distinguished ladies and gentlemen, please permit me to bring for the next presentation from the National Health Insurance Authority. The Director General has pre-informed us that he will be providing a representative, an able representative. But just before that, let me quickly recognize the presence of some other dignitaries in our presence who have been supporting the APC Medical Council. We have here with us my boss, the #1 medical woman in Nigeria. If you're a female doctor in Nigeria, you're definitely queuing behind her, and you should appreciate her efforts, not just in the medical women politics, but also in maternal, newborn, child health, and I must say, nutrition in Nigeria. Please welcome the National President of Medical Women's Association of Nigeria, Dr. Zainab Kwaru Muhammad Idris. Fortunately, you don't have to fill jam form now because I'm not sure the space provided will be enough. Another round of applause for the M1 President, please. We also have here with us the Special Advisor on SDGs to the Kaduna State Governor, Dr. Halima Nuhu Sanda. Also joining us, Dr. Oreoluwa Fini is the Special Advisor on Sustainable Development Goals to the Lagos State Governor. Dr. Fini, oh, she's been very much around since, okay. The APC Medical Council is being supported by quite a number of technical partners, and one of them is a co-convener of the Nigeria-US UHC Forum, the CEO, DG. Please welcome Dr. Gafar Alawode, the Chief Executive Officer of DGI Consults. I beg your pardon. Sorry, it's Ramadan, and it's beginning to take its toll. The APC Medical Council has membership from within and outside Nigeria, and coming all the way from the United States to support this conference is the Chief Executive Officer of Connected Care Family Practice, also a co-chairman here, Dr. Kemi Ogunwusi. You're welcome, ma. So please, let's take one more goodwill message, and then we proceed to the next presentation on health insurance as a tool for achieving universal health coverage. And the next will be taken on behalf of the Honorable Commissioners of Health in Nigeria, the Commissioner of Health in Kano State, Dr. Abubakar Labaran. And at this point, I might have to just claim Kano State again. Another Kanawa is here with us. Another round of applause for him, please.
Thank you. Bismillah ar-Rahman ar-Rahim. His Excellency, the President, Commander-in-Chief of Armed Forces, Federal Republic of Nigeria, President Ahmed Bola Tinubu, GCFR, ably represented by the Secretary to the Government of the Federation, His Excellency Senator George Akumi, the Minister of State of Health and Social Welfare, Dr. Adekunle Salako, Minister of State Federal Capital Territory, Dr. Maria Mahmoud, the Royal Fathers of the Day, all other protocols ably observed. On behalf of the Commissioners of Health, I wish to congratulate the conveners of this very innovative convention, where focus on health is being considered. Mainly strengthening the PSC for universal health coverage. We have had what primary health care means by the Executive Director, National Primary Health Care Development Agency. And secondly, improving healthcare workforce and welfare as well as retention, which is another very big problem in the country and in the world in general. Having achieved these two main issues is going to help the health sector in the country. We hope this convention will provide a solution to many more of the health care problems in Nigeria. We also wish to acknowledge the increase in healthcare financing in Nigeria. We thank His Excellency, Mr. President Bola Ahmed Tinubu, for this. We also wish to call for continuous improvement in financing of the health care, because healthy nation is a wealthy nation. And this improvement should cut across all tiers of the government. On behalf of all the commissioners, we wish this convention a very fruitful deliberations. Well, thank you very much.
That was a very brief one for a state with such a very large landmass in Nigeria. Distinguished ladies and gentlemen, Honorable Commissioner of Health for Kano State, another round of applause for him, please. That'll be a very short adjustment in the schedule you have with you. We'll take a very, very brief thank you message, and then we move on to the core and the peak of this event, and then we'll continue afterwards. Please stay with us.
أعوذ بالله السميع العليم من الشيطان الرجيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Your Excellency, the President of the Federal Republic of Nigeria, Your Excellencies here, I would like to give a brief thank you on behalf of the APC Medical Council. As the SGF has some commitment, we would like to thank Mr. President first before he leaves. On behalf of the APC Medical Council, Your Excellency, I extend our sincere gratitude and all our distinguished guests for honoring us with your presence and for your unwavering commitment to strengthening Nigeria's health sector. We really appreciate you, Your Excellency. We really appreciate. Thank you, sir.
Thank you very much. On that note, in the history of Nigerian politics, I would say that a very remarkable moment is 1999. And I must also say that the class of 1999 governors in Nigeria are a force to reckon with in the governance of our nation from then till now, nurturing our democracy and this particular republic that we've been on. One of the champions, a formidable member of this class of 1999 governors, is the governor then, as it were, of Benue State. He's later to become a distinguished senator of the Federal Republic of Nigeria. And now he serves in the Federal Executive Council of Nigeria as the Secretary to the Government of the Federation. He's here, a very strong, staunch member of the All Progressives Congress, standing in for His Excellency, the President and Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, GCFR, and now to make his speech, the Secretary to the Government of the Federation, Distinguished Senator George Akume. And one thing you would say about them is they're ageless. As you can see, it's coming up, and I still have the image of him from back then. You're welcome, sir.
Please be seated. Well, as already said, I'm standing in for Mr. President, who is involved in some other state matters. So please let me read his statement to you this afternoon. The Honorable Speaker, Tajuddin Abbas, PhD, ably represented by the House Chair on Health, members of the National Assembly, the Chief of Staff to the President, the former National Chairman of the APC and former Governor of Kano State, my brother, His Excellency Ganduje, the Honorable Minister of State, Health, Dr. Kunle Salako, Honorable Minister of State FCT, Dr. Mariam, the DG NAFDAC, Dr. Adeye, Your Royal Highnesses, Honorable Commissioners, the DG APC Medical Council, Dr. Sam Adetoye, the Chairperson, Convention Planning Committee, Kemi Ogunyemi, distinguished invited guests, ladies and gentlemen. I am greatly honored to address this historic National Health Convention and a roundtable of our great party, the All Progressives Congress, APC. The health sector is very dear to my heart, as it is one of my administration's tools for national development. It is the foundation of productivity, national security, economic growth, and human dignity. A country cannot be prosperous if its citizens are unhealthy. That is why, under our administration, health sector reform is not an afterthought. It is a central pillar of our renewed hope agenda. In December 2023, we launched the Nigeria Health Sector Renewal Investment Initiative and signed a Universal Health Coverage Compact, a bold framework to reposition healthcare delivery across our dear nation. The focus is very clear: improved governance, equitable quality health services, unlocking the health value chain, and strengthening health security. Our goal is to save lives, reduce physical and financial pain, and produce quality health for all Nigerians. And we are making very significant progress. thanks to the leadership of the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, and his team. Permit me to give highlights of some of the progress we have made in our reform effort. 1, PSC revitalization. We're working with state governors, local government chairmen, partners, and the private sector to improve the functionality of our primary health care facilities across Nigeria. We have upgraded 2,565 primary health care centers. This means these facilities now have adequate health workers trained in integrated services, providing 24-hour service. They have accommodation and a supply of basic medical equipment and essential medicines with 24-hour power and water supply. Another 1,456 undergoing revitalization and will be completed soon. Health financing, that's number 2. We have strengthened the basic health care provision fund and consistently disbursed the quarterly allocation to primary health care centers, with over 98 billion disbursed to support operational expenses for over 8,300 primary health care facilities last year. Also, we are expanding this very critical sustainable domestic financing mechanism to an additional 5,212 primary health care centers to reach a total of over 13,500 facilities. We have expanded health insurance coverage and provided it to over 10 million vulnerable individuals. Human capital development, that's number 3. Number 3, human capital development and retention. In 2023, I tasked the Minister of Health with retraining 120,000 primary health care workers within 4 years. This is to empower them to deliver quality health care services to our people, and also to enable them compete with their counterparts across the world. In just 2 years, over 78,000 frontline health workers have been trained. These include doctors, nurses, midwives, and so on. 4, recruitment of skilled birth attendants and community-based health workers. To address manpower shortages in our primary health care centers and communities, we are incentivizing states to recruit skilled birth attendants and community-based health workers. 17 states have keyed into this initiative. So far, they have recruited 3,093 community-based health workers and over 19,000 skilled birth attendants, with many more states at various stages of the recruitment process. We are also expanding residency training, reviewing remuneration, and welfare frameworks. 5, maternal and newborn health. Through our flagship maternal newborn mortality reduction innovation initiative, we are tracking pregnant women in 172 of the highest burden LGAs, linking them to health facilities for antenatal services and supporting them throughout their pregnancy journey until childbirth. Over 100,000 pregnant women have been tracked and referred to primary healthcare facilities for antenatal delivery and post-delivery services. We are offering free emergency maternal and newborn services in supported facilities because no woman or newborn should lose their lives because they cannot afford life-saving services. We are expanding emergency transport and ambulance services to ensure pregnant women and other Nigerians receive timely care at no cost to them when they need it. Unlocking the value chain, that is local production of medicines. Through the presidential initiative for unlocking the healthcare value chain, We are incentivizing local pharmaceutical manufacturing, thereby reducing import dependency and creating jobs within the health value chain. We are strengthening regulatory capacity, supporting backward integration of active pharmaceutical ingredients, and encouraging the production of medical consumables. These are impactful outcomes that you should be proud of and celebrate, first as Nigerians and as members of our great party, the APC. You haven't celebrated now. Thank you. Today, I stand before you as a proud torchbearer of the APC and urge you to join me in delivering quality healthcare services to our people and indeed in giving hope to all Nigerians. Role of APC leaders. As a ruling party, we must hold ourselves accountable in our various leadership roles, especially as governors and legislators. This convention is strategic. Health, as we all know, is on the concurrent legislative list, and we must begin to ask ourselves difficult but pertinent questions. For instance, 1, are state health budget increasing in real terms? 2, are our health facilities truly functional? 3, are health workers being motivated and retained? 4, are funds reaching facilities directly? 5, in all, are we delivering on the dividends of democracy for Nigerians? May I remind us that the success of our health reforms will depend largely on alignment between federal, state, and local governments, supportive legislation, budget prioritization, and political commitment at subnational levels. We must institutionalize the health reforms. I therefore challenge every APC governor to increase health budget allocation towards the 15% Abuja Declaration benchmark. Ensure primary healthcare and secondary healthcare facilities functionality, not just construction. Strengthen state health insurance schemes and increase enrollment in them. Publish measurable annual health scorecards. Call for partnership. Our party APC is rooted in enterprise, innovation, and responsible market participation. I call on all well-meaning Nigerians, the private sector, and development partners to join us in our task of providing quality healthcare for all Nigerians. Permit me to use this opportunity to thank and appreciate all our royal fathers and faith leaders who attended our last week's unprecedented traditional and religious leaders summit on health. I look forward to activating all the commitments and a strengthened community partnership. Our call to action. This convention must not turn into a mere talk shop. Let APC be the first party to institutionalize health reform in Nigeria. This convention should set measurable targets and results. I urge the National Executive Committee of our party to consider requesting annual reports on key health and development indices from our serving governors and even local government authority chairmen. To all APC members worldwide, let us lead with evidence. Let us govern with compassion. Let us reform with courage. To all Nigerians, health reform is not politics. It is patriotism. The strength of a nation is measured by the health of its people. Together, we will build a healthier Nigeria. God bless the All Progressive Congress. God bless the Federal Republic of Nigeria.
Distinguished ladies and gentlemen, the SGF, together with His Excellency the President of the Federal Republic of Nigeria, deserve a louder round of applause. And of course, affirming the commitment to the APC Medical Council is another aspect worthy of representation. May I respectfully announce, distinguished ladies and gentlemen, that the SGF, as you may be aware, is pressed to attend all the issues and is actually quite pressed. So if we can crave the indulgence of His Excellency for just 60 seconds to please take group photograph right here before he takes his, makes his exit, we would be most kindly appreciative of that. I'll leave the Secretariat to please arrange the order of the photograph. Can the representative of the speaker, yes, please, well positioned. Other distinguished guests can please join. Fortunately, there are steps that can be used depending on how much beans you ate when you were young. I saw the bar maker of Ibadan land trying to position himself. You're welcome, sir. And please endeavor to smile, especially if you are blessed with abundance of melanin like myself, so at least you can be visible in the pictures. Thank you very much, Your Excellency. The program continues. While the we'll take the keynote address and other presentations, and then a set of goodwill messages will follow. I understand we have some light entertainment, but we'll step that down for a while. Please permit me to recognize the presence of other dignitaries in our presence. The President of the National Association of Nigerian Nurses and Midwives. Great nurses. Thank you. Represented by Professor Saleh Ngaski. We also have the Ondo State Chairman of NAM, Comrade Felix Orobode. Please put your hands together for NAM. Other distinguished guests that have been invited, the Chief Medical Director of Plateau State Specialist Hospital, Jos, Professor Chris Yogwan. And the personal physician to the Executive Governor of Plateau State, representing the Governor, Dr. Daniel Meshak. Shall we please take our seats as I invite to the microphone? We're here to talk about health, and I'm sure we're taking the pieces of the puzzle are coming together. At this point, I'd like to invite to the microphone to talk to us. But can we please have order in the house? Can we have everyone please seated? And we may not continue the presentation or the events if we're not all seated. It's obvious how much His Excellency, the former governor and the former chairman, is loved. We love you, sir. Can we please be seated? Thank you very much. Distinguished ladies and gentlemen, it's time to listen to the keynotes. And the keynote address would be delivered by a man who has served in the Federal Executive Council of the Federal Republic of Nigeria from his earlier appointment as the Minister of State for Education to the present appointment and deployment to the Ministry of Health as the Minister of State for Health and Social Welfare. Distinguished ladies and gentlemen, when he speaks with the authority of the President. When he speaks with the knowledge, having been a medical practitioner. When he speaks with the commitment of a citizen of the Federal Republic of Nigeria who looks forward to a better Nigeria in all sectors, particularly in healthcare service delivery. Distinguished ladies and gentlemen, the APC Medical Council aptly selected as a theme, investing in health, building a sustainable healthcare system for Nigerians. And who else to deliver the keynote on this than the Honorable Minister of State for Health and Social Welfare of the Federal Republic of Nigeria, Dr. Isaac Adekunle Salako. You're welcome, sir.
Thank you very much, our dear compare, His Excellency, the President, Commander-in-Chief of Armed Forces, Federal Republic of Nigeria, President Bola Ahmed Tinubu, GCFR, ably represented by our class monitor, the Secretary to the Government of the Federation, Senator George Akume, CON, the Speaker of the House of Representatives, Tajuddin Abbas, PhD, here represented by my dear brother, Chairman, House of Representatives Committee on Health Institution, Dr. Patrick Umon, our leader, the former governor of Kano State, former national chairman of the biggest party in the black world, Alhaji Abdullahi Umar Ganduje, OFR, my colleague and sister in the Federal Executive Cabinet, Minister of State for the FCT, Dr. Mrs. Maria Mahmood, Honorable Commissioners who are here present, the Director General of NAFDAC, I don't know whether she's still around. I saw her earlier. I think she was. Okay, she's okay. Local government chairman here present. The Honorable Commissioner of Kano State, who is here in his personal capacity and also representing the Executive Governor of Kano. Our royal fathers, the representative of the Emir of Kano. Let me especially recognize the organizers through the Director General of the APC Medical Council and all the members, top government officials, gentlemen of the press, ladies and gentlemen. First, let me appreciate the APC Medical Council, not only for inviting me to be here, but torchlighting the health sector and helping us to do what I'll call a self-appraisal. That, of course, means that we're not just working, we're monitoring, we're evaluating, and we're ready to make adjustments where necessary. It also underscores the fact that the APC is populated by intellectuals, professionals, people who are not just members of the party, but who have decided to bring to bear all their experience, all their professional skills, all their knowledge to ensure that Nigeria continues to prosper. So thank you very much, APC Medical Council, for this very, very important conference that you have put together. In the last half a decade, no doubt our health system globally has been challenged in unprecedented ways. First, it was COVID-19 pandemic in 2020. And then from about 2 years ago, there has been significant reduction in development assistance for health by major donors, especially the US, the UK, and Germany. Both incidences have exposed health system vulnerabilities, but has also challenged us to be more coordinated, to be innovative, and to deploy political commitment to overcome global health challenges. Today, as we gather under the banner of APC Medical Council to review our progress and chart our path forward, we do so with both humility of lessons learned and the determination to build a health system that truly serves all Nigerians. Let me begin with an honest assessment of our position before now. According to the 2023 Nigeria Demographic and Health Survey, the preliminary results shows that maternal mortality ratio stands at 512 deaths per 100,000 live births, down from 576 in 2018. Under 5 mortality starts at 110 deaths per 1,000 live births, a reduction from 132 in 2018. Neonatal mortality is at 48 deaths per 1,000 live births. Skilled birth attendance is up from 43% to 53%. Full immunization coverage is at 39%, an improvement from 31% in 2018. And modern contraceptive prevalence is at 20% among currently married women. Government health expenditure is about 5% of GDP, consistently upward since 2014, but far below 15% Abuja Declaration minimum. Per capita health expenditure is approximately $43 from all sources in 2024. Through the national health insurance coverage, though the national health insurance coverage has gone to approximately 10 to 13%, out of pocket expenditure for health remains as high as 75%, and external funding dependency stood at 21% of total health expenditure. These figures underscore the twin challenges of insufficient investment and catastrophic health expenditure that can push millions of Nigerians into poverty. Our over 30,000 primary healthcare centers were not optimally functional as of 2023 assessment. Our doctor-to-population ratio is about 1 to 5,000 against the WHO recommendation of 1 to 600, while nurse-to-patient population ratio is also as low as 1 to 2,000 against the recommendation of 1 to 300. This is further compounded by the inequalities in the distribution of health workers, where 75% are concentrated in urban areas, serving 45% of the population. The government of President Bola Ahmed Tinubu, GCFR, fully aware of these challenges, have been making concerted efforts in partnership with state and local governments, development partners, and civil society to accelerate progress and deliver a health system that will optimally serve all Nigerians. We are fully conscious of the issues at stake, and in the last 30 months or so of this administration, we have implemented a coordinated set of programs and interventions towards attaining a resilient health system for Nigeria in line with the Renew Hope agenda. So the starting point is the Renew Hope agenda and the 8-point vision of Mr. President as captured in the Renew Hope agenda. And if you look at that document, the President properly captured what he wants to do with the health sector when he becomes president. And he itemized 8-point vision. 1, health sector governance and leadership for the achievement of universal health coverage. Primary health care as the bedrock of the health system. Emphasis on preventive health care. 4, improve allocation to health care and an expanded health insurance to promote quality and equity. Local research improvement, better emphasis on mental health and drug abuse, job creation with better welfare for health workers, and also to prepare for the next public health emergency. To operationalize this vision of Mr. President, the National Health Sector Renewal Investment Initiative, standing on 4 pillars, was launched in December 2023. I will not bore you with the details of that because that has been spoken to by a lot of people. But suffice it to say that the National Health Sector Renewal Investment Initiative is being driven on the strategic imperative of sector-wide approach to ensure efficient, collaborative, synergistic, and not siloed implementation to deliver a health system that is prepared for, respond to, and recover from shocks. A resilient Nigerian health system, and I wish to share with you some of the ongoing coordinated interventions under this reform. 1, the Basic Healthcare Provision Fund, since its operationalization in 2019, has transformed primary healthcare delivery. We are built on this, and the BHCPF represents our most significant domestic investment in primary healthcare. Since the third quarter of 2023, there has been better coordination and improved absorption capacity, rising from 45% in 2019 to 78% as at the end of 2023. The National Health Insurance Act of 2024 also marked a paradigm shift towards universal health coverage. We have witnessed increased enrollment into the insurance pool of care, and the state insurance scheme have contributed in no small way to improving the number of persons benefiting from pooled insurance care and access to both national and subnational levels. Through the formal sector enrollment, the Vulnerable Group Program, and the BHCPF integration pathways, over 20 million persons have been enrolled into care through insurance mechanisms. I'm highlighting this, and I want you to follow because it speaks one by one to the priority of Mr. President as captured in those 8-point agenda. A lot of times, when politicians go to campaign, they make campaign, and when it comes to implementation, the implementation is not tailored with the campaign. In this case, you will see a consistent synergy between what Mr. President promised when he went around the whole of Nigeria with that Renew Hope agenda document to campaign to be voted for, and what is being done. If you equate and put side by side the Health Sector Renewal Investment Initiative side by side with the Renew Hope agenda and look at the health sector, you will see the similarities and how both have entered into each other. So you see that the convergence of the BHCPF and the National Health Insurance Agency represents a powerful mechanism that we're using to achieve universal health coverage, which is #1 health agenda of Mr. President. But we need accelerated state-level implementation and enforcement of mandatory health insurance provisions for all Nigerians. We thank Mr. President for the recent executive order on mandatory implementation across MDAs, including for entities involved in public procurement and defined benefit schemes for retirees. We foresee a significant acceleration exiting our 2027 target of 20% coverage. Thank you. Let us clap for Mr. President. Thank you. We have also focused largely on strengthening primary health care. And I think that has been spoken extensively by the Executive Director of Primary Health Care Development Agency, so I will not speak so much with that again. But we must also emphasize our disease-specific programs, where we have also recorded significant milestones and improvements. As an example, the HIV/AIDS control has enrolled over almost 1.8 million people living with HIV who are currently on free treatment with a national 2% viral suppression and PMCT coverage of 96% of HIV-positive pregnant women. Our tuberculosis control program at the federal and state level has recorded approximately 80% notification of estimated incidence and greater than 85% treatment success rate. The infrastructure support for TB program is at all levels of care, and we currently have at least 126 gene expert sites across the country. The malaria control program, under the National Malaria Eradication Program, has recorded significant milestones in insecticide-treated net distribution, about 63 million distributed at the end of 2023, which has increased to approximately 70% of households with at least one net in Nigeria. Malaria cases averted estimated to about 18 million annually, and 51% of pregnant women are currently receiving intermittent prophylactic treatment for prevention of malaria. The immunization program has also recorded achievements. We have achieved 57% Penta-3 coverage as at the end of 2024, up from 33% in 2017. We have recorded zero live polio virus in Nigeria since 2020. We have also achieved a milestone in HPV immunization with over 15 million girls 9 to 14 years immunized. We have also recently introduced combined measles rubella vaccines as a testament to the increasing capacity of our health system to deliver targeted public health interventions. In reproductive, maternal, newborn, and child health, we continue to make progress in ensuring survival of the unborn and future generation. The health system has recorded improved sexual and reproductive health services for adolescents and young persons. ANC coverage and visit recorded a 42% increment, more than 50% of deliveries managed by skill-backed attendants, a reduction in maternal, neonatal, and childhood mortality, and an estimated 215,000 maternal and child deaths averted. We have initiated, thank you, and continue to implement strategic human resources solutions for health. Between 2023 and now, over 37,000 health workers have been employed, with over 75% in the clinical cadre. Though migration continues to adversely affect retention, a health workforce migration policy has been developed to achieve better retention and a more collaborative contribution of Nigerian health professionals in diaspora. The Health Workforce Registry expanded quota to produce more healthcare workers, the on-the-job training of over 70,000 health workers, deployment of community health extension workers, health fellows program, national rapid response team for disease surveillance, and expanded laboratory network staffing for the 130 laboratories are all geared to optimize manpower resources, support health security agenda, and epidemic outbreak management. As part of improving the resilience of health system, Several health infrastructure developments are going on concurrently, with over 500 high-impact infrastructural projects delivered so far, and many more ongoing. A key innovation being implemented in this respect is the Power for Health initiative, designed to ensure that our facilities have reliable electricity to power excellent and sustainable healthcare services. We have convened a national dialogue to advance this course. We have a clear implementation plan, and we are confident that necessary investment to actualize this agenda from both government and the private sector will be mobilized. We have inaugurated the Nigeria Digital and Health Initiative, which laid the groundwork for coordinated action across all stakeholders. And building on that momentum, we secured the endorsement of the National Council on Health for the nationwide implementation of the NDHI. This high-level mandate led to the development of the National Digital Health Architecture, a unified blueprint that ends the era of fragmentation and establishes clear, sustainable rules of the road for all partners within Nigeria's digital health ecosystem. We're also building the foundational digital highways, like the Health Information Exchange with shared health record, national health registries, the Health Client Registry, Health Facility Registry, and the Healthcare Workers Registry, which will provide a single source of truth for identity, service delivery points, and workforce information across the sector. Today, our federal tertiary health institutions are digitized, ranging from 50 to 100% in some cases. So in few of our cases, from entry to exit, in some of our hospitals, there are no papers used. It's pure digitization. We have also invested in generating evidence for action through a research and innovation support system. One of our proudest accomplishments this year has been our renewed focus, last year, I must say, has been our renewed focus on research and innovation as the backbone of policy and system strengthening. Through the National Health Research Ethics Committee and the National Health Research Committee, we have advanced the digital transformation of research governance and ethics review processes. The launch of Nigeria's first electronic research ethics platform, supported by the US CDC and partners, marks a pivotal shift towards transparency, efficiency, and national data sovereignty in research oversight. Distinguished ladies and gentlemen, despite this commendable progress made so far, significant challenges still exist. The challenges are multifaceted, ranging from funding gaps, existing fragmentation, and coordination challenges that are yet to collapse. The persistent and threatening human resource crisis of brain drain, top-heavy workforce, frequent industrial actions, inequalities, and urban-rural distribution of health workforce, suboptimal quality of care standardization, supply chain vulnerabilities, infrastructural deficit, high out-of-pocket expenses for health, and so on. However, we have refused to be defined by these challenges. Rather, we have taken a determined stand to change the narrative now, once and for all. Thank you very much. Based on evidence from our interventions and persistent gaps, we are committed to continue to challenge the status quo by thinking innovatively and sometimes disruptively, implementing ongoing efforts with greater determination and fidelity, advocating for additional support and collaborative partnership, and continuously monitoring and holding ourselves accountable for results. In specific terms, we will continue to push for health financing reforms and make a strong case for increased budgetary allocations. And I'm happy to report, thank you very much, our National Assembly members, this year there's a marginal increase in the proposal for the health sector that has been sent to the National Assembly, and we hope that it will be returned in that same way. We will continue to ensure guarantee BHCPF release, improve capital expenditure release, and to work to honor obligations attached to our health infrastructural bond. We will continue to encourage the states to meet their health budget benchmarks and ensure that counterpart funding are released to match donor funding obligations. We are determined to expand insurance coverage by enforcing the mandatory subscription with the support of other agencies of government. We are working to scale up the vulnerable group inclusion and expand the benefit package to include catastrophic health conditions, NCDs, mental health, and emergency care services. We will continue to scale up the revitalization of our PHC to provide basic and essential services. As we ensure compliance with minimum standards of care, we will ensure additional training and deployment of the different cadres of health workers needed to ensure service delivery, fidelity, and consistency. Our digital health transformation agenda will continue to achieve frontline attention as we ensure the needed investment is provided. The National Health Data Repository remains a priority, just as we take steps to expand the telemedicine infrastructure to reach more Nigerians, irrespective of where they live or work. Without commodity security, there cannot be health security, and as such, we will take steps to guarantee supply chain security through multiple innovative approaches, including supply chain digitization and transparent commodity forecasts, procurement, distribution, and accountability systems. Our human resources for health remains a strategic asset that we will continue to invest, to sustain, to expand, and to secure. The distribution inequalities will be frontally addressed through initiatives like the Rural Retention Incentives. To further strengthen the capacity for specialist care, we will concretize our diaspora engagements plan to further convert the previously tagged brain drain to brain gain, Japa to Japada. As part of our long-term sustainability plans, we will prioritize building a climate resilient system anchored on green energy deployment, including solar, gas, and hydrogen-powered energy system. We also hope to use the carbon credits obtainable from this initiative to further finance the resilient health system enablers in our facilities. Finally, we will continue to demonstrate responsible leadership for the health system governance and accountability process. The multi-stakeholder health sector coordination platforms, like the JAR, the National Council on Health, will continue to be supported. Accountability will be both at the federal and state levels, and will continue to ensure transparent and judicious use of allocated health resources. Your Excellencies, distinguished ladies and gentlemen, we have made commendable progress in the last 2.5 years. The BHCPF is providing millions with their first access to quality care. Immunization coverage has improved significantly. Our health system is functioning despite the global pandemic of funding gaps. States are innovating. Thank you. States are innovating with health insurance schemes, and development partners are investing billions in our health security. But we must be honest that our progress is not happening at the pace to meet the need of 230 million Nigerians. Too many mothers still die in childbirth. Too many children don't reach their 5th birthday, and too many families are impoverished by healthcare costs, and too many skilled workers are leaving our shores. Health system resilience is not built overnight. It requires investment, political will, technical excellence, community ownership, and accountability, which all of us must commit to play our part. And we thank Mr. President for being with us in this agenda. Our resolve is to build on what is working while addressing critical gaps. Accelerating forward requires strong political commitment to prioritize health in our national budget, financial discipline to release allocated funds promptly and fully, technical excellence in designing and implementing programs, collaboration across sectors, levels of government, and with partners, innovation to leapfrog traditional development pathways, and accountability to our people who deserve quality, accessible, affordable healthcare. The resilient health system we seek is one where every Nigerian, regardless of location or income, can access quality healthcare without financial hardships. Health workers that are motivated and adequately remunerated and equipped to deliver care. Health facilities that have power, water, medicine, and equipment. Data that drives decision at all levels. Communities that are active participants in their health. and Nigeria that's taking a leadership position in health innovation and self-reliance. As we conclude and conduct this important conference, I call on every stakeholder represented here to renew their commitment to health system strengthening. Let this era be remembered as the period when Nigeria made the decisive turn towards universal health coverage and health system resilience. Only healthy people can translate to a healthy nation, and only a healthy people can produce a prosperous, secured, and great country. Let us join hands to deliver health to our people and make Nigeria great. And so, with peace and plenty, Nigeria shall be blessed. Thank you for your attention. I have 5 copies of the This is a copy of the State of Health of the Nation report for 2025. This captures everything that has happened under President Bola Ahmed Tinubu since May 2023 in the health sector. And I'm going to leave behind 5 copies of this report for the APC Medical Council for them to study so that they can help us propagate what is happening in the health sector. Thank you very much. Where is the, I thought you are the president. Where is the president? So, DG. Thank you.
And I'll take one, and then we can show. Okay.
All right. Well done.
Thank you. Take it out.
Well done.
You have it, States of the Health of the Nation, and that follows the keynote's address on investing in health, building a sustainable healthcare system for Nigerians. Thank you for always being committed to the ideals of an improved health sector in Nigeria. And I believe this is not just because you were appointed by Mr. President as the Honorable Minister of State for Health and Social Welfare, but because you believe that a healthy nation is a thriving nation. Another round of applause for the Honorable Minister, please. Thank you very much for the documents. Please permit me to move on to a very brief address, but before then, as I mentioned earlier on, the APC Medical Council is a convening of healthcare professionals, and the Association of Radiographers of Nigeria is here represented. Mansour Armiyao, PhD. Okay, he's waving. You're welcome. Also from the National Association of Nigerian Nurses and Midwives in Lagos State, Comrade Nurse Akinboboye is the state chairman. You're welcome. And the Kano State chairman of NAM, would we still call you a midwife or a mid-husband? Dr. Ibrahim Mekarfi. You're welcome, sir. The registrar of the Nursing and Midwifery Council of Nigeria is here represented by 2 powerful delegates, Mrs. Goodwill Stella and Mrs. Awe Adekemi. And of course, I think that's about it. We'll take one more Goodwill message. Still to come, a presentation from the NHIA. Still to come, 2 powerful panel discussion. Still to come, the annual general meeting of the APC Medical Council. Distinguished ladies and gentlemen, if you've been in the Federal Capital Territory for many years, I mean before 2023, you would agree with me that there have been tremendous changes in the structure, the architecture, and the functionality of the Federal Capital Territory. This is extended even to the health sector. And I wouldn't be so much surprised, since we have, as a Minister of State for Health, a consultant family physician herself. The Minister of State for the Federal Capital Territory will now please come to the microphone to give a goodwill message on behalf of the good people of the FCT. Distinguished ladies and gentlemen, please welcome Dr. Maria Mahmoud Bunkuri. If you don't want to collect visa before you come to the FCT again, please put your hands together for the Minister of State for the FCT.
Thank you very much, the Master of Ceremony, His Excellency, the President of the Federal Republic of Nigeria, His Excellency Asuwaju Bola Ahmed Tinubu, ably represented by the Secretary to the State Government, to the Government of the Federation, His Excellency Senator George Akumi, that was with us. The Speaker of the House of Representatives, Tajuddin Abbas, ably represented by the Chairman, House Committee on Health Institutions, Honorable Patrick Umo, the Chief of Staff to the President, Federal Republic of Nigeria, Right Honorable Femi Bajabiamila, that was also with us in the morning. All other members of the National Assembly that are here with us, the Honorable Minister of Health and Social Welfare, Dr. Ishaq Adekunle Salako, my brother, His Excellency, the former APC National Chairman, Dr. Abdullahi Umar Ganduje, CON. All other executives of various government agencies, our commissioners that are here with us, our royal fathers, distinguished personalities, gentlemen of the press, ladies and gentlemen. It gives me a great pleasure to join you this afternoon at the first ever National Health Convention and Roundtable Discussion 1.0, organized by the APC Medical Council. I wish to begin by congratulating the leadership and members of the APC National Council for this laudable initiative. This convention aligns very well with the party's vision of people-centered governance and sustainable development. The All Progressive Congress led administration under the purposeful leadership of His Excellency President Bola Ahmed Tinubu, GCFR, has consistently demonstrated its commitment to strengthening healthcare delivery and promoting policies that improve the health and well-being of Nigerian people. Let me re-emphasize that the renewed hope agenda of Mr. President Bola Ahmed Tinubu has placed the health at the core center of national development. This commitment is evidenced by the ongoing reforms aimed at revitalizing primary health care, expanding health insurance coverage, improving healthcare financing, and also enhancing workforce welfare, as highlighted earlier by other speakers. The roundtable discussion is therefore very apt and timely. Let us ensure that we deliberate on issues that contribute towards improving primary health care, maternal and child health care outcomes, and addressing other lingering health issues. Let us remain focused on practical and implementable solutions that would accelerate our journey towards the universal health coverage. In the Federal Capital Territory, we remain fully aligned with the national vision and commitment to supporting collaborative efforts that improve access, quality, and equity in healthcare delivery for all our residents. With the full support of Mr. President, our administration is committing huge resources to improve and strengthen the FCT healthcare system, both in the city and also across the satellite town. I'm delighted to see that Mandate Secretary Health from the Federal Capital Territory Administration is also one of the panelists for today's discussion. I commend the organizers once again and encourage all stakeholders to translate towards today's discussion into measurable actions that will positively impact our communities. I wish you fruitful deliberations and a successful convention. Thank you very much. May God bless our dear President, President Bola Ahmed Tinubu, and the Federal Republic of Nigeria. Thank you very much for coming on.
Thank you very much. No, I'm here. I thought to stay close to your seat so that I can have my approval granted immediately. You're welcome, Ma. Distinguished ladies and gentlemen, that is the Minister of State for the FCT, and I must say, a proud member of the APC Medical Council. JJJ in support, say aye. Again, say nay. People don't know Embelembe. Okay. So before then, I'd like to, at this point, most sincerely crave the indulgence of the representative of the Honorable Speaker of the House of Representatives. This Goodwill message should have come much earlier, but we understand that he's quite understanding with us. Distinguished ladies and gentlemen, he chairs the Committee on Health Institutions at the House of Representatives. And of course, he actually has to attend to matters concerning the committee right now. But would really appreciate him to give us a few minutes as he comes forward to, yes, you're coming forward right now, sir. Right Honorable Dr. Patrick Umar, Chairman House Committee on Health Institutions, to give a goodwill message on behalf of the Honorable Speaker. The Honorable Speaker, sir. Please, our budget is still there.
Thank you very much. The Honorable Minister of State for Health, you permit me to extend due courtesies to all the personalities that have been recognized by earlier speakers. My name is Patrick Umar, and I represent the entire people of Ikorekpene, Esienudim, Obodokara Federal Constituency in the House of Representatives. By the indulgence of the Right Honorable Speaker, I chair the Committee on Health Institutions. At this event, I also have the rare privilege of representing the Right Honorable Tajuddin Abbas, GCON, the Right Honorable Speaker of the House of Representatives. And on his instructions, I have the following remarks to make as his goodwill message to the APC Medical Council. It is indeed an honor to address this distinguished assembly of medical and allied health professionals at the APC Medical Council National Health Convention and Roundtable. I commend the Council for providing a structured professional platform to deepen policy engagement in the health sector at a time when Nigeria is undertaking far-reaching institutional reforms. The theme, Investing in Health, Building a Sustainable Healthcare System for Nigerians, is not merely aspirational. It reflects a national imperative. Healthcare investment is not consumption expenditure. It is capital investment in human productivity, national resilience, and long-term economic growth. A healthy population underpins educational attainment, labor efficiency, national security, and social cohesion. The 10th House of Representatives recognizes that Nigeria's healthcare system faces structural challenges, inadequate financing, weak primary healthcare coverage, infrastructure deficits, uneven distribution of medical personnel, regulatory bottlenecks, and persistent out-of-pocket expenditure that burdens households. These realities require not incremental adjustments, but comprehensive reform. In this regard, I wish to highlight that President Bola Ahmed Tinubu, GCFR, has recently transmitted a suite of health sector reform bills to the National Assembly. These legislative proposals seek to modernize governance structures in key health institutions, strengthen regulatory oversight, enhance transparency in the health financing, streamline service delivery frameworks, and reposition the sector to attract both domestic and foreign investment. Among other objectives, the reform package aims to strengthen the legal and institutional framework for primary healthcare delivery and improve coordination between federal, state, and local health authorities, enhance accountability mechanisms within federal health agencies, and clarify mandates to reduce duplication and inefficiency, modernize regulatory systems governing pharmaceuticals, medical devices, and health services to align with international standards, promote local production of medicines and medical consumables to reduce import dependency, and improve supply chain stability, expand and deepen health insurance coverage with a focus on vulnerable populations and the informal sector, and improve data management, digital health integration, and evidence-based planning within the sector. These reforms are designed not only to address the immediate service delivery gaps, but to reposition Nigeria's healthcare system as a strategic pillar of national development. As Speaker, I assure you that the House of Representatives will treat these reform bills with the seriousness and urgency they deserve. We are committed to expeditious legislative consideration while ensuring thorough committee scrutiny, stakeholder consultation, and alignment with constitutional principles. Our objective is to deliver a coherent, implementable, fiscally responsible, and results-oriented legal framework. Beyond legislation, the House will continue to exercise disciplined oversight of health sector appropriations. Budgetary allocations must translate into functional primary healthcare centers, well-equipped teaching hospitals, timely release of funds, and measurable improvements in service delivery. Oversight is not adversarial. It is a constitutional responsibility to ensure value for public resources. We also recognize the urgent need to address the migration of healthcare professionals. Retention strategies, improved working conditions, and investment in training capacity must form part of our holistic reform agenda. Legislative support will be calibrated to encourage workforce stability while expanding opportunities for specialization and research. I commend the APC Medical Council for mobilizing professional expertise in support of national policy objectives. Structured engagement between policymakers and practitioners strengthens democratic governance. Evidence-based contributions from this convention can meaningfully inform the legislative process and enhance the quality of reforms. Let this roundtable move beyond diagnosis to practical solutions. Let it produce recommendations that are implementable, measurable, and aligned with Nigeria's broader economic reform trajectory. The House of Representatives stands ready to collaborate with the executive, the professional bodies, development partners, and the private sector to build a healthcare system that is accessible, accountable, and sustainable. I thank you for your commitment to national service and wish you fruitful deliberations. God bless the Federal Republic of Nigeria. The Honorable Minister of State for Health, the Right Honorable Speaker has asked that I announce the donation of the sum of 10 million naira to support the APC Medical Council. Thank you and God bless you.
Thank you very much, sir. You see, one of the reasons I would like to be rich is, can you see the way he softly announced 10 million naira? Can you see the difference? If they had passed down notes to me and I want to read, I'm sure I would do something like, the Honorable Speaker has announced 10 million naira. But you see, it's just... Thank you very much, sir. And we truly appreciate this donation. We move on to the panel session. We thank you all most sincerely for staying back up till now. And please permit me to invite to the panel our distinguished panelists to discuss improving maternal and child health. First on the list is Professor Joseph Ikechebelu. Let's put our hands together for him, please. Next, I'd like to invite, very quickly, because our time is fast spent, the Honorable Commissioner of Health in Ogun State, Dr. Marcelina Tomikoka. The panel will also be joined by Honorable Dr. Aminu J. Hassan. Let's put hands together for him as he comes forward. And I'll also like to invite from the M1 constituency, Dr. Mrs. Ime Edwin Okon. And this panel will be ably and professionally moderated by a doyen of broadcasting in Nigeria. She's mastered this podium, a lectern like this auditorium. She knows the geography. For decades she's been doing it, and she's always proudly supporting us. Our very own dear Chief Mrs. Moji Makonjola, MFR. I've been asked to please crave the indulgence of our panelists that the DG NHIA would spend, as a conversation starter, if you may, talk to us about health insurance and financing for universal health coverage. The DG NHIA, Dr. Kelechi Ohiri, is here ably represented by Mr. Kofi Abubakar. He'll speak for 5 minutes, and then the panel will start. You're welcome, sir.
I'll make it 3 minutes in view of the time. And please allow me to stand on existing protocols. My name is Dr. Abubakar Kulfi. I'm the Director of Planning in the National Health Insurance Authority, representing the DGCO NHIA, Dr. Kelechi Ohiri, who is unavoidably absent. I had earlier shared a presentation, but I've been told that there is technical glitch, so I'll try to speak to my presentation as it is. I'll just build on what the Minister of State has said and other speakers have said, that tremendous reforms have happened in the health space, anchored, of course, by the strong leadership at the Federal Ministry of Health level, and, of course, the technical and strong leadership and expertise at the NHIA and the MPHCDA, among others. The NHIA has leveraged on these reforms that the Federal Ministry of Health has developed through the National Health Sector's Renewal Investment Initiative and has come up with 4 pillars that will serve as the anchor of moving Nigeria towards universal health coverage. The first pillar is improving coverage with health insurance. The second pillar is improving quality of care. The third pillar is strengthening and improving equity in service delivery and access to care. And fourth pillar is anchored on improving the sustainability of the health insurance ecosystem.
These pillars that we have developed sit on three enablers. The first enabler is data and technology. Second enabler, of course, is community and citizen-centered engagement. And the third enabler is organizational health and structure. Of all these pillars and the strategic directions that we have followed, some significant achievements have happened in the health insurance ecosystem. Number one is the rapid increase in the health insurance coverage in the country. As I speak to you, at Q4 2025, the health insurance coverage in Nigeria stands at 21 million Nigerians covered with health insurance. In 2003, it was 16 million. Today, it's 21.7 million. That's 4.93 million Nigerians enrolled within 2 years. Ladies and gentlemen, this is the fastest health insurance growth in the history of Nigeria, and it's anchored in this government. The second thing that has also been developed is that the government has specifically targeted in initiatives and interventions that would drastically reduce maternal mortality and infant mortality. To this end, we have rolled out a comprehensive, what we call the Free CS program in code. It's actually called the Free CMONC program, as well as the Free Fistula program. These programs have been targeted to provide comprehensive free access to maternal and child health services to women and children that are vulnerable, and then subsequently enrolling them. In addition, we are aware of the sustainability gap due to the dwindling of donor funding. So we have rolled out a phased program to see how we integrate TB and HIV services into health insurance. We are pilot testing in 4 states, Ebonyi, Anambra, Gombe, and Kwara, plus Lagos, 5 states. And as of today, we have covered 30,000 Nigerians that are living with HIV or TB into health insurance. This we see as a window to ensuring that we sustain in the eventual case of course, donor exit, because most of these programs are donor dependent. So finally, I want to say that building on all these successful reforms that we have achieved and the achievements that we have recorded, we are anchoring our strategy moving forward on 5 things. One, we want to ensure that we rapidly scale up coverage with health insurance, building, of course, on the state social health insurance agencies, the private sector, and other stakeholders. The second thing we want to do is to ensure that we digitize, leverage on the FMOH-driven digital innovation to use data and technology as enablers for recruitment, for enrollment of health insurance, as well for improving quality and equity of care. And then, of course, we want to ensure massive citizen engagement, and we want to focus more on vulnerable individuals. Specifically, we are targeting to cover retirees, we're also targeting to cover elderlies, as well as scale up these interventions that reduce maternal and child health services. So to this end, I want to say, I wish the organizers of this meeting a very fruitful deliberation, and also to inform you that the doors of the NHIA are open to you for collaborations, for engagement, so that we can collectively work together to scale up coverage with health insurance. Thank you very much.
Can we just start? Okay. All right. Very good afternoon, very distinguished ladies and gentlemen, Your Excellencies or representative of excellencies here present, and very, very distinguished participants. Our high-level roundtable panel is going to be looking at improving maternal and child health in Nigeria. We all know where the status is today. We are really not there in spite of all the efforts that we've listened to. And I like the fact that I wish the Minister of State was still present, because he was bold enough to say that we're not where we should be. We are crawling, supposedly, but we can run faster. So for me, Nigeria continues to have one of the world's highest maternal and neonatal mortality, accounting for about 20% of global statistics. This is very worrisome. And if we are speaking truly to the survival of the next generation of Nigerians, we'll not just be talking about the newborns, We'll also be talking about the mothers staying alive to give proper foundation to these children. So we have here very important people with me who are very grounded in what we are going to be speaking to. And I hope you don't feel too lonely, the man, who is sandwiched amongst us. But seriously, you can't be here without a mother, right? So we'll just, please meet Professor Joseph Ifeanyichukwu Ike Jebelu, who is a professor of obstetrics and gynecology at the Nnamdi Azikiwe University in Oka, and of course, honorary chief consultant at the Nnamdi Azikiwe University Teaching Hospital. You can get their profile here. I just want to say that we have experts here on this side of the hall. So, Prof, quickly, from a systems perspective, where do you see the most critical gaps in emergency obstetrics care delivery? And I'd just like to line that up because of the time. Now, how can referral systems between primary, secondary, and tertiary facilities be strengthened along the context of the first question I asked?
Thank you so much, the moderator, and thank you, my audience, and everybody that's listening to us this afternoon. From the information we've heard from the minister, the National Health Insurance speaker, and every other person who has spoken earlier, you find out that we still have a large gap in funding of our health services. Funding and making the health services affordable. There is still a big gap. Out-of-pocket expenses is still very high. And that's why the insurance coverage has to rise further so that women could go to the hospitals anytime they are in need of it, pregnant women, and get treated. If cost is removed, they will have easy access to Medicare. Second to it is the issue of inadequacy of our health services. Get to the primary health care, and then you find out that all the components of emergency obstetric care, blood transfusion, antenatal care, and safe delivery are not readily available. And this is a big concern, and if these are provided, then we will have a better outcome. The other aspect we have to mention also is inadequate manpower. Because if a woman gets to the primary health care or gets to the facility, and still cannot get the services because there is no skilled personnel.
Please, can we have one house? Can we please direct that the exterior noise is distracting? Thank you. Yes, sir.
Thank you so much. And if there is no skilled personnel to give the services, then the danger is still not averted. And so we still have a big gap in the skilled manpower. Others will speak about the number of trained staff that we still have available and those that are lacking. And then the final aspect in the gaps that we have is the referral system. The referral system. You find out that the woman could get to the primary health center, and once pregnancy is a natural process. And every woman, no woman should die giving birth to a baby or giving birth to life. And so when she is able to get to the hospital, and she's asked to go to another hospital, and she cannot have a means of transportation to that next hospital, or when a complication arises in a primary health care, and they don't have the means of transportation to take the woman to the secondary care, to the tertiary care, then the woman will still not receive the quality care that she is expected to, and to save her life. And that is why the referral system is very, very important. And you have mentioned the challenges or how we can strengthen the referral from primary, secondary to the tertiary. And that is to say, government has to invest in ambulance, emergency transport system. Let me use the word emergency transport system in our facilities. Even with the emergency transport system, we're also talking about a hub and spoke system, where the primary health care, we know the next point where you can send somebody to and the means of sending that person to. There are models that have been practiced in Nigeria and which have worked very well. using tricycle ambulances. These are very simple, and they can move women from one hospital to another hospital, and making sure that there is a communication between the primary hospital and the secondary hospital. I mean, provider to provider communication. Because once somebody is being moved from one hospital to another hospital, they must be informed that they are expecting a patient with this condition, and they will be ready to receive that patient. And when all these are done, we know that we are bridging the gap, and we are giving quality service to our people, and we are saving our women from childbirth. Thank you so much.
Thank you so much, Prof. Yes, you have mentioned fund. You have spoken also to access, availability, and of course, transportation, moving from one end to the other. All these are gaps that quickly must be filled if we are serious as a country to, build the bridge that will contain endless, needless deaths of our mothers. I'll come to Dr. Oluwatomi Koka. You are there at the sub-national level, and having also, we have on record some of the things that you've done to ensure that maternal care has taken, a place of importance in healthcare delivery service in your state. Now, what measurable maternal and child health targets has your state committed or will be committing within the next 5 years, and how are these aligned with national and SDG benchmarks?
Thank you very much. With Ogun State, there are baseline indices that Nigeria is tracking, and this includes antenatal care attendance, the fourth antenatal care, because there is attrition between the first and the fourth, 50% attrition rate, and facility births, immunization rates, and stillbirth attendance. Also number of women that actually receive antimalarials during pregnancy, and also the number of, because we're very big on emergency transport, the number of women that actually need transportation, get the transportation, and get referred appropriately from the BMONC to the CMONC. We've committed to this, and this is in line with the MAMI initiative that's been mentioned by the minister and the DG of PHC agency. And also, we are working with the NEMSAS to track our emergency transportation. So for us in Ogun State, the things that we've done to actually deliver on those commitments, for instance, the dichotomy between the rural and urban access to health, we've been able to address that by introducing those tricycles and having community-based transporters that are people present in the community, known to the women and the under fives. They could be religious leaders or traditional leaders or just community leaders. They are trained to drive the tricycles, and they transport the women to the PHC when they have emergencies.
I'd just quickly like to jump on, something still with Dr. Koka. How sustainable is the current maternal health financing, in your state, particularly regarding to the Basic Health Care Provision Fund and health insurance coverage? How do you bring this home to drive safe?
So the funding is in 3 parts. The federal, which comes as Basic Health Care Provision, then the state equity fund, and the partners. All this is put into a one pot in line with the sector-wide approach, which the federal government is using as their framework to deliver universal health care and the Renewed Hope agenda. So it is sustainable. I think what we need is efficiencies. The basic health care provision is a stable and dependable funding that goes regularly and is backed by law. And this could be used better by tracking and transparency and accountability and making sure that the community actually has ownership and they do ask the right questions. And you remember the red letter that the minister published. That raised a lot of interest by community members. So it made us commissioners accountable to our citizens on how we spend the money. And the governance over that starts with the Ministerial Oversight Committee, which the minister heads, then the State Oversight Committee, which the commissioner heads, and down to the community itself, where the Ward Development Committee chairman actually sits on. So the community itself is deciding what that money pays for. So it is sustainable as long as the state budgets are released.
So it is sustainable, but for me, the fact that there's community participation and community ownership goes a long way to at least allow for that continuum. So if, would you say that Ogun State is working towards the SDG 3 that is helping us to cut down on maternal mortality?
Oh, certainly, our maternal mortality rate is 179.
What has happened?
No, well, the thing is, it's all concerted, using all those initiatives, those innovations, and making it sort of synergize and align, and then bringing that reduction in maternal mortality rate, because we are getting women into the facilities. They are meeting health workers. We've recruited, as we mentioned, lots of community health workers. We are tracking pregnant women in the community and making sure that they get to the facility. When they get to the facilities, the equipment, the commodities, the staff they need are there, and the transport system. I'll just mention this quickly because I know we're rushing.
Okay, yes, I would get back to you because yes,
the three delays.
The three delays quickly.
Yeah, the three delays is delaying the woman seeking and actually being able to afford that. We are addressing that with the transportation and the health insurance, which is the equity health insurance. The second one is the facility, the commodities, the health workers, and the third one is the referral to the CMONCs, which the federal government has invested
And
heavily.
these can be activated across board, right?
It's
So
present
because
in
we're
most
supposed
states.
to be, it's supposed to be a learning process and
They're
experience.
piloted, being piloted by Ogun State, but a lot of states are on board with it as well. Okay. And there's been a lot of investment from the federal ministry and PHC agency.
All right, I'll move straight to Dr. Ime Maria Edwin Okon, who is the M1, 25th, I hear, 25th President of M1 Lagos State Branch, and currently serves as Medical Director and Chief Executive Officer at Ibeju Lekki General Hospital. She's a seasoned public health physician with over 25 years, still counting. And again, a graduate of University of Ilorin. I'll tell you why I needed to say that. But seriously, now, how does poverty, education, and gender norms continue to shape maternal and child health outcomes?
Okay, so good afternoon, everyone. Thank you, Auntie Muji, and good afternoon, Honorable Commissioner and Prof. Okay, so I've been trying to resist calling poverty, lack of proper education, and unfavorable gender norms, the vicious cycle for women, because it is something that stares us in the face and it is right before us at every point in time. The poverty is there. It is very palpable. And for women, the economic realities are there. When a woman is poor, she finds it difficult to even get transportation to go and access care. For herself, during antenatal, for her child, when her child is ill. And this also, the low socioeconomic status, are the kind of things that will make a woman to stay in a place where she doesn't have, maybe there is overcrowding, and there's a lot of debt around that can cause diarrhea for the child. overcrowding can expose to pulmonary tuberculosis and other pneumonia things that affect the child. And of course, that can be harmful to her if she's pregnant. When she gets to the hospital, if she eventually gets to the hospital, she gets transportation, how does she access care? So many people are still paying out of pocket. She's not able to pay to get the care that she deserves, truly deserves, the skilled care. So education is meant to be that pad that gives advantage. So if she's poor and she's educated, then she will know the warning signs during pregnancy. She will be able to go to the hospital and register early enough for antenatal care. She will not drop off, like Honorable Commissioner mentioned. She's supposed to have like 4 antenatal visits. She won't just go once or go at the stage where we call head on perineum, when the baby is almost out. Okay? So if she's well educated, she would be empowered. And poverty would be, even if she's poor, the education will be that leverage for her. Then talk about the gender norms. Some women still need permission before they can go to access care for themselves and their children. I'm a community health physician. I've gone to places where a woman tells you, sorry, I can't give this vaccination until the father is around. And you go around and you see the father is just somewhere gisting with his, or playing draft somewhere. You know, very ridiculous that the woman cannot take a decision while waiting for this man that is busy enjoying himself. So those gender roles are there. And like I said, it's a triad, it's a cycle, and it affects the women anyhow you want to look at it. Remember what we always say about education. Educate a woman, you educate a nation.
Thank you
Apologies
very much.
to the males.
Yes, so important. Educate a woman. And I'd just like to, elongate that to ask that, how is the maternal health benefiting from the present health policy thrusts, like SWAP, like MAMI, like the National Health Renewed Hope, initiative, putting all this together and looking at, the data or the information available concerning women in Nigeria, what do you want the stakeholders to do differently?
Okay, so I want to say that it's a plus, actually. And I think we should give a round of applause to our government for these initiatives that are coming up. So when the women know that when they get to the hospital, you don't have to pay for this, that encourages them. Sorry, before I move forward, I want to mention a scene. I don't know if we saw that thing on social media once, because it happened around the area where I work. There was a video that went viral that a man was talking about his wife. The wife was in the car with her, and he said he went to a private hospital. They said he should deposit 500,000, and he couldn't afford the 500,000, and they said he should take his wife to General Hospital, Ekpe. I work, Ibejuleki is like 20 minutes from Ekpe. So that story went viral. I was like, okay, so what happened? Why didn't you come to General Hospital, Ibejuleki? That's close. So he went all the way from a private hospital in Ibejuleki and on his way to Ekpe, only to be proclaimed that the wife was dead. I don't know if you saw that video. So that is where all these initiatives come in. If this person had registered in a government facility at a PHC where he could access all these facilities, CMONC it's in my hospital. Mami is in Ibejuleki local government. So we can assess that the women have opportunity of registering and benefiting from this. We had to refer a child recently to the hospital where CMONC told us that, like you said, hub and spoke, right? So you have Outreach Children's Hospital where the children can access free health services, So this has given a positive impact. And the women are more, they come to the hospital more because they know when they get there, they can access some of these services and they do not necessarily have to pay out of the pocket. So we are happy, we appreciate this, and we hope the implementation will be sustained so that we can continue to have more women access skilled services, especially during the antenatal
Thank you
period.
very much. I'll quickly come back to Prof. And how can stakeholders support the effort of the government of Nigeria geared towards reducing maternal deaths through the Mommy initiative, which she has spoken to? And what innovative approach should be made? What is that big gap that people, I mean, these initiatives are there, but people can't access it? Is it because they have no information?
Thank you so much. The Mommy initiative is a very great achievement of this present government. And what we need is the stakeholders to key into this. It's only in 172 local governments presently, but it can be scaled up. We have 774 local governments. So we need stakeholders to buy into the government initiative. And if this is working, and truly is working, women can get to any of these facilities that's already taking up the initiative, and I can get skilled care and every other thing. So expand the Mommy initiative, take it to other local governments and other facilities, and that's where we need the partners, NGOs, funding agencies, CSOs, even private individuals and private organizations and companies and every other person who want to be ensure that no woman dies or no woman dies while she's giving birth. The causes of maternal death are preventable. Hypertension, bleeding, obstructed labor, sepsis, these are all preventable deaths. The second aspect of it is also supporting the federal government with resources. They can actually provide, if you remember what happened with the HIV, even TB, and all these others, these are making sure that these services are available and making sure that these services are available at no cost to the woman, where the woman will not pay out of pocket. And if this is made possible with this Mommy initiative, then every woman will be happy to get to the next available health center and government establishment, knowing that once I get there, I will receive care and I will be taken care of. And if she's going to the next hospital, there will be transportation available. So we need support in the area of emergency transport system. And this is what can happen with engagement with private organizations, even what we call them, road transport workers, and every community leaders, churches, and mosques and organizations. They can actually support the government with this emergency transportation system because they are in the community. That's what the commissioner said by talking about community ownership. Mm-hmm. And when these things are done, then our women will be sure that their lives are safe. Yeah. And I add, yes, that add the aspect of skilled midwives, making available skilled midwives who will go to the community, live in the primary health care, provide them accommodation. They live in there. When they are living in there, it gives confidence to any woman that at any time of the day, if I get there, somebody is there waiting to take care of me. Yes. And that will help us with what we're doing.
Access, trust, yes. Availability of skilled human resources. Now, I'll come to you, Honorable Commissioner. What governance mechanism ensuring accountability and transparency in maternal health resources allocation? How do we get this? Because when people know what is available, when people know what you're doing, I'm sure it will go a long way to build trust and also build demand.
Thank you very much for that question. I think we have to look at what we've been doing so far. We've focused on the facilities and left out the community. There has to be huge community involvement and engagement. And that starts with the WDC that I mentioned, the community, the World Development Community, which are people in the community that are put together to have oversight of their own health care. Then within that, there is, in the facility, the accountability we have introduced electronic medical records, so you can triangulate what's being used. So the resources, maybe drugs, commodities that we send, we can see how many patients are seen and how they've used those commodities. And there's a work plan that the officer in charge of that facility has to submit on an annual basis. And that has to be approved by the technical team at the Primary Healthcare Board, which then is audited annually by the National Primary Healthcare Board. So there is a well-structured governance framework that overlooks what the money, the resources, both human and commodities, how it's being used. But
I have to ask you to please wrap up on that so that I can have other people speak.
Sure.
Right. Thank you. I think very explicit what Commissioner has said is doable, is actionable, and of course the fact that you can is evidence-based, so you're not making up papers. 1 minute, I will come back to you, Dr. Okon. What scalable models exist for integrating community-based maternal care into formal health systems?
Okay, so we talk about primary health care under one roof. So we're looking forward to having a PHC where a mother goes there, she can access her services, and also for her child, everything is under one roof. Remember the collaboration between ministries, because health is not a standalone. There is a collaboration with Ministry of Women Affairs, Environment, Education, Finance, of course. So if everything is put together with transparency and proper accountability, that is what we are looking forward to, so that we can achieve the universal health coverage that we are all looking forward to.
Thank you very much. I'll just give you 1 minute each to round up, and the question I would want you to address is, how do we move from policy formulation to effective implementation and measurable impact? I'll start with the Honorable Commissioner. It's the same question for all of you.
With what we have, we can actually start to utilize and build in efficiencies. We have the policies. Implementation, MAMI is a very good framework to use. And then using basic healthcare provision as a resource to execute MAMI. That's the way we have to go.
Yes, Dr. Everyone?
Yes, so we have our SMART objectives that are time-bound, things that are realistic, that we have the targets, and we're able to have key performance indicators to be able to hold people accountable. This is the promise, and over time, we are able to measure it from time to time, maybe monthly, maybe quarterly, to see if we are moving towards the goal. Thank you very much.
Prof?
The aspect of commitment from the caregivers. They must be committed and they must discharge their services knowing that they are also attending to fellow Nigerians, not actually extorting from fellow Nigerians. Give the services and respect the woman who has come to the hospital, and be sure that this woman will receive the safe care that she's expected to receive. And government has done a lot in giving the necessary support. We need, as individual Nigerians, to key in and continue the services and sustain it.
Thank you very much. A couple of pillars that has come out from this conversation. One, community engagement, community ownership, which breeds transparency, which breeds trust, which also breeds acceptability of initiatives, ensuring that people understand. So education becomes also important, particularly for the girl child or for the woman. Education, education, education. Without education, we can't go as fast as we would want to. So it's important. And then the huge gap, funding. Funding must also be addressed for the peculiarity of the needs of women. Women, the way they are structured, needs some measure of special care. And until, of course, as a people and as a government, we take this into cognizance that achieving the health goals means that the special needs of women must also be addressed. I want to thank my panelists. Thank you for taking me through school again. Dr. No, thank you. And Honorable Commissioner, thank you for what you're doing. And thank you for the evidence-based results that we are getting. And of course, Prof, thank you so much living in women's world, even as a man. Thank you. And thank you very much, audience. Thank you so very much for your time.
Thank you very much. And Prof, blessed are you among women. Can we have the DG APC Medical Council please step forward for a group photograph with our panelists? And thank you very much. It's always a pleasure listening to Chief Mojima Konjoala handle the microphone the way she's been doing for decades now. And can we please have the next panelists get ready? But just before then, if you use a Taj bank account, I have a message for you. If you use a Taj bank account, I have a message for you. You know your account number, you have your ATM card, but the ATM card is missing. Please reach out to me. I have it here with me. Oh, you thought I wanted to send money? Even me, like my friend Liko, are looking for money. Permit me to also recognize the presence, very quickly, of the Director General of the National Agency for the Control of AIDS. She's been here with us in the spirit, joining us online, but here physically, ably represented by her special assistant, Dr. Ibidapo Fashino. You're welcome, sir. We also have here with us, you know, there are two parties in Nigeria, the APC and others. Even the others, you see, it's not loud. You couldn't say it out loud because all parties are now harmonizing. There's alliance and realliance. And so, representing the good people of Kogi is the Chairman House Committee on Customs and Excise, Honorable Elder Leke Joseph Abejide. But he's here, ably represented by a Special Advisor on Public Communications, Honorable Bashiru Abdul Muhammad. Let's put our hands together for him. We also have here with us a friend of the house, quite proud supporter of the APC Medical Council and a proud member of the APC, the Bameko of Ibadan land, Oloye Said Oladele. You're welcome, sir. At this point, I'd like to invite to the seats provided the next panel. And the discussion is on improving workforce welfare and retention. Please welcome. Okay, I see Dr. Fashawa is not here. Is she represented here? No. Okay. So, first on the list is a past president of the Nigerian Medical Association, a past Honorable Commissioner of Health in Kogi State, a past running mate to Honorable Leke Abejide in Kogi State, a past president of the Association of Professional Bodies of Nigeria, past this, past that, Dr. Idris Omede, FNMA. You see him walk up the stage, you wouldn't know he's been the president of the Nigerian Medical Association for as far back as 2010. You're welcome, sir. I'd like to be like you when I grow up. Next, I'd like to invite pharmacist Dr. Sholakwe Adenuga. Oh, you're welcome, ma. Yes, you actually look Shalakwe. This is Irish Shalakwe I know the looks. You're welcome. Is it the same Adenunga? Oh, nice. I'll see you later, man. Next, representing the Nursing and Midwifery constituency, please welcome Professor Saleh Garba Ngaski. I thought there were more nurses in the house. You're welcome, sir. Oh, are you in white because you remember those days when you wear uniform of white? Please welcome to moderate this panel session. To moderate this panel, I'd like to invite to the microphone Professor Waziri Garba Dahiru. And please note that all members and intending members of the APC Medical Council should please stay back and for the annual general meeting of the APC Medical Council. And of course, that includes a very formidable member of the APC Medical Council who had to cross seas, spent millions of naira, ensuring that she's here from the diaspora, a very active member of the APC Medical Council in diaspora, a princess of the source. Please, let's appreciate the owner of Connected Care Family Practice, Dr. Kemi Ogunwusi. And please join in the panel. You're welcome, ma. May I crave your indulgence to please speak Ife English to us and not American English so we can understand. Thank you very much. And can the panel please proceed for the next 20 minutes, please?
Thank you very much, MC. And I know we have been sitting here for a very long time, so we aren't going to take too much of your time. Today's discussion is basically on high-level medical council round discussion on improving workforce welfare and retention in Nigeria health sector. We all know that Nigeria continues to experience workforce migration, industrial action, moral decline, and retention challenges across the health sector. So today's discussion is going to focus on practical, sustainable, and policy-driven strategies to improve workforce retention and skilled professionals within our system. As a background, when we are looking at the statistics over the last few years, we all remember that on the statistic, about 5,000 doctors basically left the shores of Nigeria and practicing in United States of America over the last 10 years. And going by the NHS record, we have about 6,000 medical doctors all over the United Kingdom practicing medicine there. And over the last 25 years, between 2010 and 2015, we have about 150,000 medical professionals, doctors, dentists, nurses, radiologists, and what have you, practicing all over the world, leaving the shores of this country. This is a huge problem for Nigerians and medical sector in general. So today with me, I have prominent people that have been very active in either institutional management of either medical profession as in NMA. I have Dr. Idris Omede here with me. And we also have somebody very conversant with the nursing profession that has been in and out of training nurses from undergraduate to postgraduate, and has been very active in nursing association management, Professor Saleh Garba Ngaski. I also have Dr. Sholape, a very conversant pharmacist that knows in and out of pharmaceutical practice in Nigeria. So my question, let me start with Dr. Omedi. From your leadership experience, what are the primary drivers of physician migration from Nigeria to other countries?
Thank you very much, the moderator. The primary drivers of migration of healthcare professionals from Nigeria to other countries can be itemized as: one, remuneration; workplace environment; career development; work overload; and security matters. Remuneration has been a very touchy thing with regards to migrations in our country. This is something that is very prominent and very obvious, and one of the causes of disruption of services in our country for quite some time. It is not deliberate, but it is something that has to do with a comparative relationship between what is obtainable here and what is obtainable in other climes. That has been one of the major things that has been causing migration. On workplace environment, issue of infrastructure has been very touchiest. A lot of facilities do not have and not maintained from the structures they were for a long time. And where they are, equipment, both diagnostic and therapeutic equipments may not be available, in addition to the essential commodities that are required to deliver services, be it drugs, be it consumable. So most physicians find out that they don't have that job satisfaction in terms of delivering. Another issue is career development. In regards to training, particularly the postgraduate training, there are no clear-cut, until recently, where we have the Residency Act, there are no clear-cut career development outlines for people that are doing it. And so arbitrarily, so many things are done. That is one thing that negates the development, retention of people here. Workload, like you have said, moderator, because of the migrations that we have, the few that are available are overburdened with work, both from the junior doctor to the senior one. More with the junior ones, particularly with the level of house officer, medical officers, junior registrars, senior registrars. They're overburdened with calls and routine work, to the point that at the end of the day, they have a lot of burnouts, and people get stressed beyond limits. This has caused a lot of worries in the course of why they are doing those work, to find alternative ways of getting things done. And that amounts to cause for those desire to migrate. Then insecurity. For quite some time now there have been, which is not peculiar to doctors or health workers alone, there have been issues of kidnap, ransoms here and there for people that don't even have the resources. And often you find out that not only kidnapped, some families end up losing their breadwinners, who are other health workers that were kidnapped because they were unable to provide those funds. So these are factors that have continued to contribute to migrations. And having listed this, I think we'll say the government has been doing some bit of it to see how they can be addressed. Yeah. And strongly, I want to say that most of the things that have been said here today, I'm happy that the government side were admitting some of the areas they've not done too well, but they are aware of it. I think one good important thing is to have a system that admits and realizes where the challenges are, which right from the ED of Primary Healthcare Agency today, and then the Minister of State for Health and Social Welfare did admit to some of them. I think most importantly, I'm aware that the Nigerian Medical Association has been calling for collective bargaining agreement, which with the government agencies. That meeting was begun, but was suspended. We are happy that 2 days ago, when the NMA leadership met with the Minister of Labor, there was pronouncement that within 2 weeks' time, that will resume. Okay. In fact, I believe that if the issues raised in the collective bargaining agreements are addressed, it will, the brain drain will reduce drastically. And it is important that government take it very serious. And not only for doctors, it will affect all the health sector, professional in health sector, if this is done. Infrastructural-wise, I think from what we have, what at the 2023 launch of the Nigerian Health System Renewal Investment Initiative, that was supposed to address this migration, address local productions of pharmaceuticals, and see how the medical tourism can be reversed. And I think, importantly, these are not things that we can get immediately. There are things that will come over time, because most of those, where you have seen these migrations, are where doctors practice and pharmacists, nurses, laboratory scientists practice. That is mainly within the secondary healthcare and tertiary healthcare. And this is where the migration is much more. So I think we think very well too. In terms of the infrastructure, the Power for Health initiative, which has been launched, where most health facilities are supposed to be solarized across the 36 states, federal government health facilities, and I think the state government too should buy into it. For the 36 states where federal health institutions are, including FCT, are to be solarized. And I'm aware there are pilot work already going on in Maiduguri Teaching Hospital, in UCH Ibadan, I think in Aminu Kano Teaching Hospital, and the University of Calabar Teaching Hospital in this area. Those things are the things that give some comfort and relief to the practitioners when they are working, because you need a conducive work environment to, beyond the remuneration we are talking about, to do your work very well. Thank you.
Thank you very much for taking us beyond the questions and into other aspects of the healthcare professional. Dr. Sholape, I know that it's not only the medical doctors that have this issue of migration all over the country. So how do current policy framework actually affect pharmacists and professional growth in job satisfaction in Nigeria so that they will not be going out of the country?
All right, thank you so much for that question. Currently, there's the Pharmacy Council of Nigeria Act, which licenses pharmacists, the trained pharmacists, they have the regulate pharmacists, and then they have the stipulated guidelines, and they define the scope of practice for pharmacy. And these policies for the Pharmacy Council of Nigeria, these policies delineate a scope of practice. They give legitimacy to the profession. They give a legal backing to the profession, and they give stability to the pharmacy profession. And so these policies give pharmacists the credibility and recognitions as professionals within the health service system in Nigeria, and they give them give them standards that are global. So pharmacists, having that policy framework as a background, they have the confidence to practice properly in the country. Also, the Federal Ministry of Health and Social Welfare, they also have policies that give pharmacists credibility, stability, and legitimacy. It is when there are gaps in these policies, and when the policies are not well or fully implemented, that professionals such as pharmacists, they start to have low morale. They have low morale, they feel underutilized, they feel unrecognized, and therefore they feel the need to seek validation and better prospects elsewhere. For example, the policies for training of pharmacists that guarantee that the pharmacists that are being produced from our institutions of learning have the skills, they have the knowledge, they have the competences to practice, and they spend commensurate years of learning, and they now come out and they have the entry levels that they're given are not commensurate to what they expect, and the remuneration, it's a bit below expectation. So that makes them feel frustrated. Then the job satisfaction is not there. So that's what contributes to migration of pharmacists from the country. Also, the Pharmacy Council of Nigeria Act, which I keep referring to, they've delineated a structured career pathway that makes up for pharmacists to achieve what is known as the consultancy pharmacist cadre. And a lot of pharmacists have actually have postgraduate education and qualifications that allow them to practice as consultant pharmacists. But when you have very partial implementation of this policy, it's very discouraging to the professionals. So they feel undervalued, and they don't feel that they can practice or achieve their full potential within the health system as it currently is. A lot, however, I must add that quite a few institutions have already implementing these consultancy cadres that we're actually aspirating for. They're implementing it, and pharmacists are practicing in that capacity. But for other areas where they are not being practiced, the pharmacists, you can imagine how they will feel, and that is part of the push factors for migration. Number one, as the last speaker said, the first speaker, the number one is remuneration, work conditions, and inability to achieve full potential for their career pathways. Also, when you talk of remuneration, professionals such as pharmacists, you see that there's a salary disparity between comparable cadres, and that does not bode well for retention of pharmacists within the healthcare system. Also, when you talk about working conditions, where the infrastructure is there, is getting better, the equipment, they're there, but then sometimes you find out that the conditions of space where the pharmacists have to practice, they're not really that conducive to make them really want to stay within the system. The space is sometimes inadequate. You find out that you see this beautiful hospital, you walk in, the infrastructure is intimidating, you have the consulting rooms, they're there, they're comfortable. But then if you care to move a little further within the hospitals, you will see a little cubicle reserved for pharmacy, which shouldn't be the case. When we're designing hospitals, designing hospitals must take into consideration that there are global standards for pharmacy practice. And hospitals have to be purposely designed to accommodate these global standards. So pharmacies have to be comfortable, conducive, and professionally designed to encourage ethical pharmacy practice. Also, another push factors for pharmacists that encourage them to emigrate is non-inclusion in leadership roles. Pharmacists are skilled, they're competent, and they're knowledgeable for inclusion in national and state programs. And this non-inclusion of pharmacists in that program, in such programs, are quite discouraging. And they feel they might as well leave the country and go to other climes where their skills and competencies are appreciated and well recognized and utilized. So those are the majorly push factors that cause migration internally, and also there are some push factors that cause pharmacists to migrate internally from the rural to the urban, chief of which is remuneration and working conditions. Thank you.
So can I just follow up with a follow-up question? You know that a lot of challenges in the pharmacy profession between what we find in tertiary institutions, secondary institutions, primary centers. So these challenges, what do you think can be done to close the gap for pharmacy services that will cover both primary, secondary, and tertiary institutions? Because going by what we have seen all over the nation, you go to a primary center, you'll not see a pharmacist there. A few pharmacists in the secondary centers, most of them were located in the tertiary center. So how can we have a balanced distribution so that those services can effectively cover the whole of the country?
Thank you very much. And your observation is correct and is valid. In fact, today, I was very delighted when the NPHCDA told us about the laudable achievements of this present administration with regards to primary healthcare revitalization. He spoke glowingly about the investments in infrastructure, equipment, and power, water services. All those were very laudable, and I was so encouraged about the future of healthcare system in Nigeria, particularly with the investments in the primary healthcare, which we know is actually the bedrock of health systems in Nigeria. However, having said that, you still find out that human resources in the primary healthcare setting is still very abysmal, particularly as concerns pharmacists. Workforce with pharmacists is particularly skewed towards the secondary health facilities and tertiary, and the reasons are not far-fetched. It's basically because the remuneration at that level is still quite poor, and nobody really wants to be, in spite of the beautiful infrastructure and investments that have been put in the primary healthcare level, nobody wants to stay where the incentives are not good enough for them. Because everybody wants to have a basic, some quality of life in which to operate. So what we need to do to encourage professionals, particularly pharmacists, because you have rightly observed that you hardly find pharmacists in the primary healthcare setting. So, and then the ED also mentioned that staff are being trained, particularly a lot of money is going into training community health workers. They actually, which is laudable and which is good, but they actually should be supporting staff in the primary healthcare. They should be supervised by pharmacists. So going back to your question, Prof, what do we need to do to retain pharmacists at that level? Number one, we need to give them allowances, rural.
In 30 seconds.
Okay, allowances, hazard allowances, rural incentives, basic housing, insurance, and other, and medicines have to be available for them to work with. Well, that is being worked on a bit now with the central procurement at the state level, but we have to make sure that the structures are not just redundant with no health workers qualified, particularly pharmacists, to actually work in those facilities.
Thank you very
Thank
much.
you very much.
I think we have to be a little bit faster. Okay. Sorry for the timing. Professor Saleh Garba, I know that we have a lot of issues when it comes to the ratio of nurses, especially with this Jabba syndrome. How does workload to staff ratio affect or have impact on services quality and professional satisfaction of nurses across Nigeria?
Thank you very much.
In 2 minutes, please.
Yes. Thank you very much, the coordinator, the moderator for this question. I want to briefly give these statistics. Between 2017 to 2025 alone, Nigeria lost 68,000 nurses. 68,000 nurses left Nigeria officially between 2017 and 2025.
Yeah.
The highest being recorded between 2022 and 2024, when over 42,000 nurses left. And the WHO recommendation for the ratio, for instance, for population, nurses to population, WHO is saying about 83 nurses to 10,000 population. In Nigeria, the ratio is about less than 2 nurses to 1,260. The statistic is so terrible. In the hospital, it's worse. And nurses are the largest workforce. They are the whole workforce that stay with the patient 24 hours. And you imagine one nurse staying with 40, 50, 16 patients for a period of 8 hours, working alone. In some places, because of the scarcity, nurses don't run 3 shifts again. They run 2 shifts. That's 12 hours. In most rural hospitals, that is the situation. So definitely with the workload, considering the serious deficit of nurses are overworked. There's no way they can provide effectively what is required as per standard. In most cases, burnout, they are stressed and so on. So it's really serious as far as workload is concerned. It is affecting service delivery. And the funny thing is that over the years, there has been a very significant improvement in enrollment. It is not as if the nurses are not there. Over the last 3 years or so, the Nursing Council, over the last few years, the Nursing Council has increased quota. A lot of licenses have been given to even private colleges. So nurses are being produced. As they are living, they are being produced. We are facing 2 kinds of shortages. One, they are migrating. The other is there is no employment. Employment only takes place in most of the tertiary facilities. Many states don't employ. It is worse with the local government. You don't find nurses there at all. And there's no way you can talk of quality service delivery at primary healthcare level, where 70% of the total population of the country are obtaining care, and you don't find nurses and midwives there. So workload effect is seriously affecting. No replacement in most of the hospitals. Over this last 5-10 years, I can tell you in some states, no employment has been done.
5 seconds. Yes. Okay. Thank you very much. We have heard from basically the leadership of nurses, pharmacists, doctors all over the radio that they need more money to improve on what they are doing and remuneration and what have you. So I just want to ask Dr. Kemi, how can doctors, nurses, and other allied workers or other health professionals work together to improve health outcome in Nigeria, looking at all the scenario that we have and all the problems that they have outlisted here?
Good afternoon. In any healthcare system, we have what we call TEAM, T-E-A-M. Together, everybody achieve more. We know doctors cannot do the work of nurses, and nurses cannot do the work of doctors. But we have to create an environment that everybody can collaborate together. When we look at the picture that we are all here to service patients, it's all about the patients. So when we have that at the back of our mind, the doctors and the nurses, they need to work together for the benefit of the patients that they're there for. But that is the primary reason why everybody resumed to duty. So when doctors and nurses, when there's no collaborative working relationship with them, and there's no collaborative communication between them, there is going to be a gap created. And this gap that is created is going to affect the patients. Because when doctors, because I've been doing medical mission in Nigeria for a while, and I've seen how they communicate with each other. And you can tell that from their communication process, the nurses, they feel kind of belittled, they feel kind of suppressed, that a lot of them, they can't even look up to the doctors that are talking to them to communicate with them. I think that is the system, that's what I noticed, that is the system in Nigeria, and which is not good because it's going to affect the care outcome that we're providing to our patients. So I just want a situation, an environment where doctors and nurses, they can work together, communicate with each other, check on each other, because number one, nobody knows it all. From the world that I came from, when a doctor gives an order, let's say, for instance, a doctor's write maybe furosemide 20 milligram PO twice a day. The nurses are the ones that do all the vital signs. They have the weight of this patient. They have all the demographic information of this patient. So this order goes through the pharmacy, who do the second cross-check. There is this dose. Is this safe for the patient? Because a lot of times when we write orders, we are working on the, because we, like he said, that we have a lot of patients that we have to see. Everybody is working under stress sometimes. Sometimes we just write something that we're not even sure if this dose or this medication that we are writing is completely safe for the patient. Yep. So, but when it passes through to the pharmacy look at it, that, is this safe? Then it goes to the nurses. Because the nurses is the final check, because they are the one to administer the medications. Okay, so when the nurses and the doctors, when they don't have that relationship that they can communicate with each other at that low level, so there's going to be this fear that, oh, if I go to Dr. Ogunwosi and tell her that this medication that you've written, are you sure you want me to give this medicine? But when that relationship is not there, they're not going to be able to come to me to ask me if this is right thing to do. So I just want a change in our healthcare system here in Nigeria, because this is my home. I don't care how many years I've used in America. Nigeria is my home. I'm passionate about Nigeria. And we need to change Nigeria so we can be on the same level with all these other countries. We are talking about people who are jackpot to the other countries because they see something different from what we are doing. How can we bring that culture back to our country? Yeah. So we need to start from communication, from the people that work together. Nurses and doctors, we need to work together for the betterment of our patients. We need to appreciate each other, because without the nurses, the doctors cannot function. Without the doctors, the nurses cannot function. So
thank you very much. In 1 minute for each and every one of you, one question each. It's just a straightforward question I'm going to ask you. We know that year in, year out, we end up having incessant strike. Either doctors are on strike, or nurses are on strike, or other professionals are on strike. How can we as association, collaborate with the government and stop that strike from happening in Nigeria? 1 minute, sir.
I think the one major issue here still boils down to remuneration. Most of those strikes you hear about is remuneration is one of the key issues, in addition to all the other things we have listed. So if people are giving their remuneration as required, which I think this collective bargain agreement contains basically all the items that have been causing demonstrations and strikes, which will permeate across the health sector. It will go a long way in reducing this strike.
Thank you very much. Remuneration.
Thank you.
Okay, Dr. Shalape.
Thank you so much. So you asked how we can prevent strikes, incessant strikes. So I'm going to give you 3 ways in which we can do so. The number 1 is dialogue, number 2 is dialogue, and number 3 is dialogue.
Thank you very much.
So we must dialogue continually and not resort to ad hoc negotiations. And there is a trust deficit that needs to be, that gap needs to be bridged. There should be transparency in dealings between the government and health labor organizations, and full implementation of any memoranda of understandings that must have been agreed upon. Thank you.
Thank you very much. Prof. Saleh?
Yeah. We have to look at why are we having the disagreements most of the time. Remuneration, poor condition of service, particularly in the place of work. For the nurses, non-inclusion in leadership situation. We are part of the system, we don't take part in decision-making process. And then, of course, very importantly, the ability to practice our art according to our training. So government should be responsive in ensuring that whatever is agreed upon is implemented. And then for the union, in the course of the dialogue, they should be very realistic in their request for whatever it is that is needed. So if this dialogue, this agreement is there, realistic demand, and then sincere implementation of agreements, then constant dialogue from time to time. We don't have to wait until we have to give warning for strike and so on. From time to time, we can dialogue with our unions, and our unions will give advice as to how to move forward. Thank you.
The last words from Dr. Kemi.
Yeah, I think number 1 is we need to do the root cause analysis. That what is the cause of the strike? Then once this board of the hospital or the healthcare system, they can meet with the government and tender out the root cause analysis, and the government officials can work with them. I'm so happy to hear all the new improvement that the current APC government are doing in the healthcare system in Nigeria. And I think with that, we will see less strike, because with all this new development that the new government is doing now, there's going to be less strike. So let's find the root cause analysis, present it to the government, and we collaborate together to resolve the problem.
Thank you very much.
Thank you.
We really appreciate you for coming to this panel discussion, Dr. Kemi, Professor Saleh, Dr. Adenuga, and my president, Dr. Omedi. Thank you very much. And we appreciate you for listening to this discussion. Thank you.
Thank you very much. Yes, please, for a group photograph, can I have the DG, the Secretary General, and the Chairman, Central Planning Committee, please join. Behind every statistic is a mother, a child, a community. And that is why maternal and child health issues are not just women's issues, they're national issues. We had a robust discussion in the first panel session. A tired workforce cannot sustain a nation's health. Retention is not just about preventing migration, it's as well about creating value at home. It's been a very impressive day listening to the panelists discuss on improving healthcare, workforce welfare, and retention, as well as strengthening primary healthcare for universal health coverage. We've heard from the agency in charge of health insurance in Nigeria. We've heard from the head of primary healthcare services in Nigeria. We've listened to the Honorable Minister of Health, Honorable Minister of State for Health, I must say, and Social Welfare. The Speaker was here. The Speaker spoke. His Excellency, the President of the Federal Republic of Nigeria, was here, ably represented by no other than the Chief Scribe of the Federation, the Secretary to the Government of the Federation. Ladies and gentlemen, it's been a wonderful time. At this point, I'd like to invite to the microphone as we gradually get to the end of this event, pending the annual general meeting of the APC Medical Council, which will happen as soon as we close this event with the national anthem. But before then, please welcome to the microphone the Secretary General of the APC Medical Council and Secretary of the Central Planning Committee, Dr. Fauzia Buba Idris, for the vote of thanks, please.
Your Excellencies, Royal Father, permit me to stand on the existing protocol. On behalf of the APC Medical Council, I extend our deepest appreciation to Your Excellencies and all our distinguished guests for honoring this historic National Health Convention, a roundtable with your presence and invaluable contributions. I wish to specifically recognize and sincerely appreciate the Central Planning Committee, our chairperson, in form of Dr. Kemi Ogunyemi, our Director General, Dr. Samuel Adetoye, the chairman and secretaries of all various subcommittees, as well as members of our esteemed council, for their tireless dedication, coordination, and sacrifice in making this convention a great success. Your commitment has been truly outstanding. Importantly, I wish to assure all healthcare professionals across the country that the APC Medical Council is funded on the principle of inclusiveness, unity, and mutual respect. This council belongs to every healthcare worker. It will provide a platform where all voices will be heard, where everyone is involved in decision-making, and where every cadre of the health workforce is recognized as an equal and valued partner. There will be no segregation and no superiority or inferiority, only unity and shared commitment to strengthening healthcare in the system of Nigeria. Thank you all for your presence and support. God bless the Federal Republic of Nigeria. Thank you.
Thank you very much. God bless you too. We now receive royal blessings, especially in the month of Ramadan. As we close this event with a closing prayer, since we commenced with an opening prayer from the Lord Bishop, it's important to close this with the representative of the Emir of Kano, Alhaji Umar Ado Bayero.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وصلى الله على النبي الكريم. Your Excellencies, other invited guests, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Before I proceed to the closing prayer, let me share the message of His Highness the Emir of Kano, Alhaji Aminu Ado Bayero. His Highness, wishing the participants and the organizers of this conference a productive and successful event. May discussion be fruitful and lead to the meaningful outcomes. His Highness urged all the participants to continue support President Bola Ahmed Tinubu health reform to get better Nigeria. Thank you. So let me pray. I pray in the name of Almighty Allah. Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Ar-Rahmanir Rahim. مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين اللهم صل على محمد وعلى آل محمد كما صليت على إبراهيم وعلى آل إبراهيم وبارك على محمد وعلى آل محمد كما باركت على إبراهيم وعلى آل إبراهيم إنك حميد مجيد سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.
Thank you very much. Amin. Distinguished ladies and gentlemen, with this, we have come to the end of this historic event. And on behalf of the APC Medical Council, I want to sincerely thank you for staying till this moment. Today, we spoke health, and tomorrow, Nigeria must feel it. And history will be kind to us that we did, and all that we did by the time we depart this hall. And in reverence to the country Nigeria, may we please rise as we take the national pledge to close the ceremony. May I remind all members and intending members of the APC Medical Council to please stay back for the annual general meeting. So we recite the pledge on the count of 2. 1, 2. I pledge to Nigeria, my country, to be faithful, loyal, and honest, to serve Nigeria with all my strength, to defend her unity, and uphold her honor and glory. So help me God. Amen. Thank you. Let's put our hands together and do have a safe trip back to your various destinations, except you stay in the villa. Can we have music, please? Thank you. For a group photograph. Thank you. And shall we have light music, please? Or any music? Thank you very much. Again, The APC Medical Council Annual General Meeting starts immediately. Thank you very much. I most sincerely appreciate you all for making this job easy for me. My name is Hamid Adediro. Those who know me call me the medical star because I have the honor and privilege of combining the prestigious professions of being a medical doctor and a broadcaster. Have a wonderful rest of the day.